Good morning, everyone, and welcome to the ABTA Cognitive and Emotional Wellbeing After Brain Tumor Diagnosis Patient and Family Meeting. My name is Emily Lippert, Program Manager here at the American Brain Tumor Association. We are delighted you have joined us online today. The ABTA's patient and family meetings are free events typically held across the U.S. where brain tumor patients and loved ones can network and hear from experts about updates in brain tumor research, treatment, and care. We chose to host our meetings again virtually this year to protect the health of our community during the COVID-19 pandemic. Although we are saddened we cannot connect and network in person, we hope our virtual program will be an enriching experience for each of you today. Since we are unable to meet in person, we decided a fun way to interact and engage is to have a few polls throughout the meeting. When a poll is launched, a box will pop up prompting you to respond to the question. Your answer will be anonymous and only collective results will be shown. Let's launch the first poll now. All right, what region of the US are you tuning in from? Ooh, it's a tight race right now. We have representation from all over, even international. I'm going to give you a few more seconds. 5, 4, 3, 2, 1. Let me share the results. Look at this. We have so many people from all over the place. Wow, this is pretty close. We have the Midwest with the highest with 21%. It's great to see that we have people from all over. Okay, next question we have. Please rate your overall understanding of cognitive and emotional health. This is just to gauge where everybody is at as we are entering into this meeting to learn more. And we truly hope that each of you will gain more understanding and knowledge after today's meeting. Okay, a few more seconds. 5, 4, 3, 2, 2.5, 1.5, 1. Okay, great. I'm going to share the results. Okay, we have 58% with a general understanding. We hope that each of you will gain a greater understanding after this meeting. Thank you, everybody, for participating. All right, without further ado, I would like to introduce to each of you our chair, Dr. Ashley Logan. She has been such an excellent contribution to this program and planning, and we really appreciate her leadership in putting together this wonderful topic and each of the speakers that she has selected for today. Ashley, welcome.
Thank you very much. I'm so excited to be here. I'm honored to be asked by the ABTA to chair this event. And I'm even more excited to bring awareness and knowledge about the importance of quality care in our brain tumor programming and patient trajectory. I have 2 goals for this meeting. I have brought together experts that truly understand and work with brain tumor patients on their quality of survival. So my hope is that we will provide education, that the attendees will feel validated in their experiences, and will gain some pearls of wisdom and some knowledge of how to implement better strategies into their life to improve their overall quality of life. My hope is that you guys will grab some things from these presentations and be able to implement them to have a better day tomorrow, a better day next year, and a better day for years to come. I'm excited to be here. Thank you, Emily.
Thank you so much, Ashley. We really appreciate all your hard work and effort that you have put forth towards this meeting. I would now like to also thank each of our speakers for taking the time out of their day to share their insight and expertise with us. Additionally, thank you to each of our sponsors, ABTA's gold sponsor, Novacure, and our silver sponsor, GT Medical Technologies, for the support of this virtual event. Without the time and effort from each of these individuals and organizations, we would not be able to bring you this quality educational programming that has brought together the brain tumor community. All right. We are about to get started with our very first session. Our first session today is all about the American Brain Tumor Association. The ABTA continues to be a proud advocate, and we are steadfast in our mission to be a strong ally and resource for the brain tumor community. This presentation will discuss the many ways that we are here to serve you and how you can get involved. Please help me to welcome ABTA's Director of Patient Services, Mindy Freund.
Thank you, Emily and Dr. Logan. Good morning, everyone. I'm so excited to be here with you all today. As Emily mentioned, my name is Mindy Freund, and I'm the Director of Patient Services here at ABTA. We're so glad all of you are here today, and I know without a doubt that you're going to leave here with new insights and takeaways. The mission of the ABTA is to advance the understanding and treatment of brain tumors with the goals of improving, extending, and ultimately saving the lives of those impacted by a brain tumor diagnosis. We will start by discussing our mission in action with research. So since we started 49 years ago, we've awarded over $33 million in brain tumor research grants. This includes more than 750 research projects funded throughout the US and globally, and 678 different researchers supported. We believe it's important to continue to support early career investigators who are entering the brain tumor research field because they're the future of brain tumor research and bring many of the innovative outside-the-box ideas that will hopefully lead to the next discovery. One way that we continue to support them is through our ABTA Alumni Research Network. We started this network in 2012, so 10 years ago, and every year we hold a 2.5-day meeting where we bring together our research alumni to learn about brain tumor science, to network, share ideas and resources, gain knowledge around grant writing and managing a lab, and other career development skills. Over the years, we have seen several collaborations grow organically out of this network, which has led to an increasing number of joint publication amongst our AARN members. Now we'll move on to discussing our mission in action within our patient services. So one of our new offerings that we just launched at the end of 2021 that we're very excited about is our Brain Tumor Treatment Center Guide. This guide points to high-quality brain tumor centers throughout the US and includes things such as the number of central nervous system specialists, how many patients are treated per year, specific technologies utilized, support services, if clinical trials are offered, and so much more. You can access and search this guide on our website. Another resource we offer is our vast array of educational materials. We have 18 printed brochures free of charge to patients and caregivers, which are also available to download on our website. The About Brain Tumors was our first brochure back in the early 80s and still remains a popular educational pamphlet today. We also have several brochures on specific treatments, clinical trials, and individual tumor types. CareLine is the ABTA's phone and email informational service. The purpose of our CareLine is to provide support, information, and resources to brain tumor patients and caregivers. If you ever have a question about where to find information, this is a great place to start. We will get calls ranging from those needing emotional support to those seeking financial aid resources or requesting more information about their tumor type or treatment options. Although this is not a place for medical advice, it is a place that may be able to give you some help in advocating for yourself by providing guidance about what questions you can ask your providers to get the answers you're looking for, or by pointing you to some evidence-based articles on the topic. If we don't know the answer, we can oftentimes find the person or resource that will know the answer. The next service I'd like to highlight is Connections. So this is an online community where brain tumor patients, survivors, and caregivers can come together to share their experiences and support each other. This is similar to a Facebook group, except it has the benefit of being monitored and you can be anonymous if you would prefer. Within this community, we also hold week-long sessions called Ask the Experts. This means we have a medical expert on a specific topic available to answer any questions you may have about that topic. Coming up at the end of May, our topic is on rehabilitation, and in October, we will have an expert available for any questions about acoustic neuromas. Next up are our free virtual webinars. So these are held almost monthly and are hour-long live presentations from medical experts about topics requested by patients and caregivers. Our most recent webinar, just this past Tuesday, focused on developments in treating malignant brain tumors, and our next webinar coming up in May will be discussing how to manage the financial burden of a brain tumor diagnosis. If you want to watch any of our past webinars, you can find them on our YouTube channel, American Brain Tumor Association. Our free virtual and patient family meetings, like the one you are attending now, are half-day meetings designed for patients and caregivers to learn and gain support surrounding specific hot topics of interest. This year, we will be offering 3 patient and family meetings. In March, our meeting focused on navigating a brain tumor recurrence, and coming up after this meeting in June, it will focus on research and clinical trials. These meetings are also all recorded, so you can find them on our YouTube channel. The National Conference is our largest conference dedicated to patient and caregiver education. This year, it is still virtual and will occur on September 9th and 10th. Our goal is to provide patients and caregivers with access to nationally recognized brain tumor experts to learn about a variety of topics, including, but not limited to, things like treatment, disease management, new research, and support services. This year, it will be led by Dr. Vinay Gandhi from Northwestern Medicine and Dr. Nancy Oberheim-Busch from UCSF. We are also using a new virtual platform that will be easy to navigate and provide additional ways to interact with others if you choose to do so. Registration is open, so head on over to our website to register and take advantage of the amazing program that we have put together for you guys. Our patient and caregiver mentor support program is a great option if you're interested in one-on-one support. We match mentors and mentees based on their diagnoses because we understand it can be helpful to speak with someone who has been through a similar journey, and it can also be very rewarding to share your experiences with someone in need. Getting involved with the ABTA is a wonderful way to give back to the community. Team ABTA is one of these ways and is made up of individuals who run, bike, or swim to raise funds for brain tumor research and patient programs. From people who've never run more than a mile to annual marathoners, members of Team ABTA all have the common goal of finding a cure. We also have our Fundraise Your Way program, and this is a great option for people that want to host their own events to raise money toward our cause. These events could be things like bowling, golfing, or wine tasting. Be creative. Our BT5Ks are yet another way to support our mission to provide critical funding for brain tumor research and patient services. If you're in the Chicago area where we are headquartered, we would love to see you at our Chicago BT5K tomorrow, bright and early at 8 a.m. at Maggie Daly Park. You can register on our website if you haven't already. And if you're not in the Chicago area, we also have events coming up in Michigan, Columbus, New York, the Twin Cities, LA, San Francisco, and a virtual option as well. Volunteers, we love our volunteers. If you are one of them watching this meeting, a huge shout out to all that you do. Your help does not go unnoticed, and you are an integral part of our mission. If you're interested in volunteering with us, some ways you can volunteer include speaking opportunities, like you'll see today from an inspiring patient and spouse, becoming a mentor for our patient and caregiver mentor support program, volunteering to help at our BT5Ks or conferences that we're exhibiting at, cross-promoting our resources and events, reviewing website content, and much more. We would love to stay connected with you after this meeting if you're not already. Our e-newsletter provides stories and announcements that inspire and inform patients, survivors, caregivers, and families. You can also follow us on social media, including Facebook, Instagram, LinkedIn, Twitter, and YouTube. Lastly, we would love your ongoing support to help us continue to move our mission forward to ultimately save and improve the lives of those impacted by a brain tumor diagnosis. Thank you so much for listening, and I hope you all learned something new about the ABTA. And with that, I will hand it back over to Emily.
Thank you so much, Mindy, for sharing with us all about the mission of the American Brain Tumor Association. So our chair, Dr. Logan, she's going to introduce each of our speakers today. Dr. Logan is an associate professor of neurology in the Division of Neuro-Oncology at Virginia Commonwealth University and a clinical neuropsychologist at Massey Cancer Center. She is the director of Live Now, a thriving clinic and lab dedicated to the mission of improving overall well-being for brain tumor patients and their loved ones, ensuring that quality survival throughout the disease trajectory. Please welcome back our chair, Dr. Logan, to introduce our next session and speaker.
Thank you, Emily. I am honored to discuss our first session, brain tumors and their treatments can affect thinking, resulting in daily life changes. In this session titled Cognitive Concerns and Daily Life Implications, you will learn about the cognitive domains that may be affected before, during, and even after a brain tumor diagnosis. Our speaker, Dr. Mike Parsons, is an assistant professor at Harvard University and a board-certified neuropsychologist at Massachusetts General Hospital. He specializes in the effects of brain tumors and other cancers on cognition. Dr. Parson works with patients to understand their cognitive concerns and guide treatment of those problems in order to improve their day-to-day functioning. His research goal is to actually understand the causes of these cognitive problems and to assist in developing effective treatments for those that are impacted. I first met Dr. Parsons through a mutual research interest, and we have quickly become colleagues. We not only scientifically collaborate together, but we also assist one another in training the next generation of psychologists focusing on brain tumor quality care. I'm honored to welcome my friend, Dr. Mike Parsons.
Thank you, Ashley. It is a real pleasure to be here and an honor to be part of the program. I just want to extend my thanks to the American Brain Tumor Association. I appreciate so much the work that you do and frequently using and recommending your resources to the people I work with every day. I will take a moment to acknowledge research support that I received from a charitable foundation based in Chicago, not far from the ABTA, the Dr. Scholl Foundation, who, although their funding originally comes from the feet, they have seen fit to fund some of our research into brain tumors and the effects of cancer and cancer therapy on the brain and cognitive function. So what we're going to be talking about in this session is all about cognition, brain function, and the way in which brain tumors affect those abilities. Not only the tumors themselves, but the treatments that people have to go through when they have a brain tumor contribute to the cognitive issues. I'll first talk a bit about brain organization to kind of lay the groundwork for understanding the impact of brain tumors and their treatments on different cognitive abilities. We'll talk about which cognitive abilities are most likely to be affected, and then I'll walk you through what a neuropsychological evaluation is and how we use our testing and assessment to understand you as an individual and how you've been affected by the tumor itself, the treatments that you've been through, and all of the other things that go on around dealing with a brain tumor. Finally, I'll wrap up by talking a little bit about managing these cognitive symptoms, which will provide us a segue into the talk coming next by Amy McGuire that will be all about taking this information and turning it into strategies. So what is cognition? We use that term as kind of a jargony term. Really, it just refers to all the skills of thought, all of your brain's abilities. Those might include memory, concentration, your speech, language, and communication skills, visual and spatial abilities, by which I mean things like navigation, judging distances, how you get things to go together. And finally, this large area of skills that we call executive functions, those high-level skills that are important for solving problems. So I'll break each of these down for you over the course of our discussion here. Now, the reason we talk about cognition is that thinking is pretty important for living your life. And it doesn't really matter what stage of life you're at or what your daily responsibilities are. A problem with cognition will have a significant impact on what you're trying to do day to day. That's true, of course, if you're in school or trying to do some job, but also just navigating the medical morass that is living with a brain tumor, and the treatment for that requires a lot of memory, comprehension, and understanding, making decisions and judging different options. Of course, maintaining independence and activities in your daily life, whether those are things like your ability to drive, the way you like to spend your time, requires concentration, intellectual ability. And then everyday activities that we may take for granted, such as caring for yourself, keeping track of your medications, interacting with others is very dependent on those communication, memory skills. Now, I'm pleased to be able to say that there are slow and gradual improvements in the medical care for brain tumors that has people living longer and longer, often many decades after the diagnosis of a brain tumor. And as those treatments improve, it's become ever more important for us to also focus on maintaining the health of the brain that keeps you going and doing the things you want to be doing. So there's increased interest and focus on these topics, not just by psychologists like myself and Dr. Logan, speech therapists like Amy McGuire, but also by your physicians, your surgeons, your radiation oncologists. So how do brain tumors affect cognition? I think it probably comes as no surprise to the people in this audience that almost everyone dealing with a brain tumor will experience some effect on their thinking at one point or another during the journey that is living with a brain tumor. Initially, right when a brain tumor is diagnosed, many of those symptoms are due to the direct effects of the tumor on the brain itself. And that can depend on where the tumor occurs, its size, and how it's growing. So for example, we'll talk a little more in detail about a division of labor in the brain, where tumors on the left side of the brain, this is true for most right-handed people in any case, tumors on the left side of the brain may be more likely to affect your language skills because language is located in the left hemisphere for most right-handed people. Whereas tumors on the right side don't tend to affect language as much, may affect other skills, but those problems may not be as obvious. So that location, which side of the brain the tumor grows on, and within each side, where in the brain it occurs, can affect the way your memory, your concentration, or speech and language may be impacted. Also, we know that the type of tumor you have has an impact on how likely you are to have symptoms such as cognitive problems or speech and language issues, emotional changes. Fast-growing tumors are more likely to cause those problems than slower-growing tumors. Of course, complications around the tumor itself, such as swelling in the brain around the tumor or bleeding that can occur sometimes into the tumor or around the tumor, can also cause cognitive problems in that early stage, even before a tumor is discovered. Now, when most of you will have had surgery for the brain tumor, and the surgeons have been very diligent and creative about coming up with new techniques to try to minimize the ways in which the surgery itself can affect your brain. And in many cases, after surgery, a person can have a real significant improvement in their thinking because the pressure put on by the tumor has been improved. And that's really credited to the surgeons who develop newer and more careful techniques for preserving the brain while getting as much of the tumor out as they can. Now, the causes of cognitive problems that can occur when you have a brain tumor are kind of multi-leveled. There are these direct effects that I was just talking about, such as pressure that the tumor itself puts on the brain cells, or swelling around the tumor that can disrupt the communication between brain areas. Also, there are other factors that you have to deal with a brain tumor, such as medications that you need to take. And simply the stress of being diagnosed with a tumor and going through all the relatively unpleasant medical issues that you have to deal with can affect your thinking all by themselves. And then the different types of treatments can also affect your brain function. I mentioned surgery just a moment ago, but as many of you know, one of the main concerns when you have to have radiation to the brain is whether the radiation itself may damage healthy brain cells that are nearby the area that they're irradiating for the tumor. Chemotherapy also can be associated with problems with memory and concentration. Many of you will have heard of chemobrain, which is a risk of cognitive side effects from chemotherapy. So there are these multiple ways in which the brain tumor process, in addition to the brain tumor itself, can have an impact, and part of the reason it's so common to have cognitive problems. So how do we evaluate cognition? This is what we call a neuropsychological evaluation that is made up of multiple different phases and tests that try to look into each of these different areas of brain function, including examination of fine motor function, visual skills, language skills, how quickly you process information, your memory abilities, your problem solving, and of course, taking into consideration your coping and emotional state while dealing with the brain tumor. This test that I'm showing you here gives you a simple example of one of the tests we use to look at fine motor skills. Here you see a person putting these tiny pegs into a little board. They try to do these peg and hole placements as quickly as possible, rotating the pegs between your fingertips to orient it properly. And this allows us to test out the integrity of the fine motor control system, both on the right side of your body, which comes from the left side of your brain, and the left side of your body coming from the right side of your brain. There are many different tests that can be used to examine these different functions, and I'm next going to walk you through some examples of the kind of tests we use to understand each individual person's profile of cognitive strengths and also problems that might have been caused by the tumor or its treatments. I'll give you a little bit of a guided tour to the brain here. What you can see is a side view of the brain. Up here is the front of the brain. This is the back of the brain. And I've drawn some colorized highlights. You don't actually have these colors in your brain, in case you were wondering, that identify some specific areas of brain that are involved in very local cognitive and neurologic function. The red area here contains the cells that map all the way out to your muscles and coordination areas, including hand, face, your trunk and body, and down into your legs and feet. So any injuries here or tumors here could affect the control of those movement areas on the opposite side of your body. Right behind that motor control area is the area that takes in sensory information from those same regions of the body. So your sense of touch, and also the senses that tell you how your body parts are positioned relative to one another. In other words, where your hand is located in space compared with your face or your other hand, that allows you to coordinate complicated movements. Behind that sensory control area is an area we call the parietal lobe that takes that sensory and motor information and brings it to a higher level of integration, giving you the capacity for things like body awareness, where your body is located in space relative to things around you. It's also involved in attention and concentration. And behind that is the main area for vision in the occipital lobe. Visual information comes from the eyes and starts right here at the very back of the brain, and then is processed moving forward into brain areas. So to test out these functions, we use a variety of different types of tasks. I'll give you an example of how we look at the visual system here. Now, your brain has been designed through eons of evolution in incredibly clever and complex ways. And the way the brain processes information is to break it down into pieces and reassemble that so that you have a map of the world inside your head. In the visual system, one of the ways that's done is by breaking information into two main pathways. A pathway where that visual information comes in from the back and then is processed going into these higher parietal lobe areas is important for helping you to identify where in space something is happening visually. Whereas a pathway that goes along the bottom of the occipital lobe into what we call your temporal lobe here helps you break down the things you're seeing to identify what they are. Those could be recognizing objects, that you're holding a mug or a pen, or recognizing faces and identifying the individual that you're seeing. We test out each of these different functions using different kinds of tasks or paradigms that allow us to look at, for instance, in the case of where pathway information processing, rotating images, putting together drawings, or making designs. And in this more inferior pathway using tasks that allow us to look at things like your ability to recognize faces. So this is an example of one of those visual facial recognition tasks in which if you were in the assessment, we would ask you to first look at this top face and then find from these 6 examples below 3 of the pictures that are of the same person's face. Now, all the while to do this task, your brain is doing an incredibly complex visual processing where it's breaking information down and reassembling it into a format that can allow you to recognize the face, as well as connect it to information you might have about the person. So if you're wondering, oops, it looks like, there they go. Some of the faces here, some of the pictures that identify this person are here, here, and here. It's just an example of a visual task that we might give you. Now, I want to talk a little bit more about that division of labor in the brain I mentioned before. As I said, for most right-handed people, the left side of the brain is important for processing language, and the right side has a predominant role in some of your visual or spatial skills. Now, you might be looking at this picture in which we're looking at the brain from the front. So imagine we're looking into your brain from the perspective of your face. So in other words, the left side of your brain appears on the right side of the image. The right side of your brain appears on the left. It's not that we're thinking backwards here, it's simply the way that images are interpreted. And when you see scans at your doctor's office, it's important to keep in mind this reversal. Now, in the middle of the temporal lobe of the brain is this important structure we're going to talk about called the hippocampus, which is critical for memory. And it's also a little bit language-related memory on the left and visual-related memory on the right. So the side on which a brain tumor occurs can affect not only your skills, but also the memory for certain kinds of information. So let's talk a little bit about those left-sided areas. This is a brain activity map that comes from a scan that's done. If any of you have ever had surgery, it involved what we call language mapping, where the surgeon had you awake in surgery and asked you to do different speech tasks. They would use a functional MRI map like this one to identify areas of your brain that are part of your language system. Those could include areas related to the production of speech, such as how long your phrases are, whether your speech is fluent and well articulated, and also the rhythm of your speech, the way you use the ups and downs and tones to express emotion or ask a question. They may also ask you to identify the names of specific objects, and word finding difficulties are probably the most common language symptom that people experience, which can come from a disruption of any of these regions spread around the left side of the brain. We'll examine your language comprehension in a neuropsychological evaluation by looking at your ability to follow multi-step directions or comprehend information you're reading. We look at reading by asking you to identify words or perhaps read sentences, particularly when these left side areas are affected, and may look at the connections between your language areas and your physical motor areas by testing out writing and spelling. Language skills can be very important for everyday activities and frequently disrupted if you have to deal with problems on the left side of your brain. Now, I want to come back to this structure I mentioned a minute ago, the hippocampus, which is critical for recent memory. Now, as neuropsychologists, we break down different types of memory, and we like to be specific about it. So recent memory really refers to your ability to make a new memory of day-to-day details. It's the kind of memory you use when you want to keep track of what you had for breakfast, or current events, or what your doctor told you at your last visit. Now, to make a good memory, there are 3 steps that need to occur. The first is what we call encoding. It's kind of a jargony term really for just bringing information into the memory system in the first place. It requires you to process that information and focus your attention. The next step in forming a new memory is storage, and that's really where the hippocampus comes in. It's kind of like a mental filing cabinet where you can file away specific details that you want to keep track of. And if the hippocampus is working, has not been, say, disrupted by a brain tumor occurring there or surgery or radiation to the hippocampus, it does its job of storing memories. And then finally is retrieval. That's the step where I ask you what you had for breakfast this morning, and you go back into that mental filing cabinet, pull out the specific detail, and tell me back what the answer is. In the evaluation, we may test these abilities, these different steps of the memory process, by asking you to memorize things like stories, words, or pictures. And what we're trying to do is identify, if you tell me you're having a problem with memory, is it one or more than one of these steps where the breakdown is occurring? And as you'll hear in a little while from Amy McGuire, understanding where in the memory process the breakdown is occurring can be really helpful in developing strategies to compensate for that problem. I want to talk about a different kind of memory here, what we call your working memory. It's kind of your mental desktop. It's the areas of the brain that you use when you just want to hold something in mind while you work with it. It's critical for multitasking, and it involves a widespread network of brain areas that create kind of a looping system that allows you to hold information in mind and manipulate it. It's the kind of memory you use when you want to go downstairs and get a spare can of beans from the pantry, or pick out a specific tool, and then you get down there and think, what did I come down here for again? That's because it wasn't held in your working memory. So we're looking for intact loop here, which can obviously be disrupted anytime a tumor or treatment interrupts any of these structures that are part of that loop. Now, working memory is also intimately connected to attention and processing speed. Attention is dependent upon this highly refined and detailed set of connections throughout the brain, which are illustrated here with what we call a diffusion tensor imaging map that shows all the various connections and fibers that are intermingling these different aspects of brain function. We test out your attention by asking you to stay focused on various tasks, to shift between competing tasks, or divide your attention between more than one thing at a time. The speed with which you process information is also really dependent on those connections and the degree to which they might be eroded or disrupted by a tumor or a treatment. And putting all this together efficiently is critical for multitasking. Finally, I want to talk about those executive functions. I mentioned them earlier, and it's, again, a little bit of a jargony term, but you can think about an analogy to the executive of a company. These are oversight functions, integrative functions, putting information together from multiple brain areas so that you can achieve a goal. The executive functions are all the abilities that you need to solve a problem, and they're divided up among several different parts of the frontal lobes, including these areas on the sides of the frontal lobes that are critically involved in reasoning and integrating information. These areas in the middle, in between, on the sides of the frontal lobes, they're involved in initiation and also judgment and knowing when it's time to stop doing something, or cessation of activity. These executive functions are tested by a number of different procedures in a neuropsych evaluation that may look into your reasoning, your ability to withhold or inhibit a response at the appropriate time, your ability to shift attention, to initiate and be spontaneous, motivated, and driven. And they require, again, a very integrative kind of ability between multiple brain areas. Oftentimes, these are the kinds of problems when they occur that people will recognize at home as just not having quite the right awareness or insight into the nature of changes that may have occurred as a result of a brain tumor or its treatment. And they're critical for exercising judgment. So I've given you a little bit of a walkthrough of the different brain areas and the kinds of abilities that depend on those brain areas. What I hope is apparent in that discussion is that there are both specific focused brain areas that are important for certain abilities, and there are also interconnections among those brain areas that are important for complex functions. Of course, the location and nature of brain tumors is that they can interrupt some of those individual functions, but can also disrupt a network and therefore produce problems throughout the network because of disconnections. As we move forward in dealing with those problems, we'll shift next to the kinds of treatments that are available. And I'm going to focus specifically here on medications and brain health activities, setting the stage for Amy McGuire, who's going to talk next about rehabilitative strategies. So when it comes to medications, there are basically two classes of medications that are used to help cognitive problems across all kinds of brain disorders. Those are memory-enhancing medications and attention-enhancing medications. I put some of the names of those medications on the slide. And the bottom line is that these medications were not designed for people with brain tumors. Studies have been done using them in folks with brain tumors to see whether or not they help. And the take-home message is the findings are a little bit mixed. What we've demonstrated is that identifying the proper fit between a specific type of medication and an individual's cognitive profile can help increase the likelihood that you will benefit from medications. In other words, if we look at your memory system and find that there's a breakdown in that storage phase of making new memories or encoding, it may be that memory-enhancing medications would benefit you. On the other hand, if it seems to be an attention-based problem where you cannot sustain attention or it's difficult to shift attention because those networks are not integrating properly, then you're more likely to benefit from the attention-enhancing types of medications. Now, I do not prescribe medications, but I will often work with my medical colleagues to inform them about the nature of an individual's cognitive strengths and weaknesses so they can have a discussion with you about the pros and cons of these different types of medications. Talking briefly about brain health is really an important component, particularly after you move from the period of time when someone is dealing with a new diagnosis of a brain tumor and the immediate phase of treatment into a period of time where you may be living a life after treatment of a brain tumor and thinking about, now that I've made it through the chemotherapy or the surgery or the radiation, what do I need to do to maintain brain health? There are a few general principles of brain health that have been primarily researched in people who are worried about aging effects on their brain or dementias like Alzheimer's disease that have also been shown to be relevant to people who are surviving after brain tumors and cancer treatments. The number one single thing that you can do for brain health is physical exercise. And that promotes brain health by improving the blood vessels that supply the brain and also affecting things like inflammatory biological markers that can have negative effects on the brain, as well as improving oxygen supply in your blood. These have been, physical exercise has been shown to improve brain health with aging and after cancer treatment. Now, you do, of course, have to talk with your doctor about the level of exercise that is safe for you, given your own particular medical situation. In terms of what kind of exercise we're talking about, the guidelines for brain health exercise are similar to those for heart health. And I'm going to give you an example from perhaps one of my favorite research projects on the effects of brain health, the effects of exercise on brain health. It was published over 10 years ago now. So what they did in this study was they took people who were at risk for brain deterioration and memory loss by virtue of having an older age and a risk for dementia in their family. And they assigned them to one of two conditions. One group of people was assigned to an exercise program. It was a walking program where people participated 30 minutes at a time every other day for a year. And they wore a heart rate monitor to see whether they were elevating their heart rate into an aerobic level of fitness zone. That was the goal. Not peak performance, not Olympic training, anything like that, but a moderate level of aerobic exercise. They followed those folks for a year. The other group was assigned to a stretching program aimed at improving flexibility. And in those people, they were looking at heart rate to see that their heart rate was not elevated into that aerobic zone during the exercise program. Again, everybody participated in the program for a year, and their brains were scanned at 3 points: once at the beginning, once 6 months in, and once 1 year into the program. And what we're showing you here on the graph is the size of this critical brain area for memory that I mentioned before, the hippocampus, both on the right and the left side. What you can see, and I'm guessing you might be able to tell which group is which color line, is that one group had the normal loss of brain volume in that area that occurs with aging, about 1 to 2% a year in the age range of the people who participated in the study. The red line was the stretching group. The blue line represents people who were in the exercise group. And what you can see is not only did their brain not deteriorate, but they in fact increased the size of this brain area over the course of the year by 1 to 2%. This kind of result has been replicated time and time again, not only in aging, but also in people who are cancer survivors, and suggests that there is a beneficial effect on brain health, represented by not only brain structure, but also performance in different kinds of cognitive tasks in some of those studies. So if you're looking for the number one thing you can do for your brain, I advocate moderate aerobic exercise along the lines of what this study did. So you might be thinking then, well, what about brain exercise? This is a frequent topic of conversation that I'll have with folks who come to see me. And the answer to whether or not brain exercise helps the health of your brain is yes, but perhaps not as clearly demonstrated as physical exercise. What we know with a fair degree of confidence is that being engaged and mentally stimulated is definitely important for brain health, especially when compared with sort of being a couch potato kind of approach. It's definitely important to be engaged in activities, but it's not necessarily clear that one kind of brain activity or mental stimulation is better than any other at promoting brain health. We want you to be engaged in activities that are naturally interesting to you, in which you're kind of in the driver's seat of the activity. You're doing something, creating something with information, making associations between things. So for example, it's great to read a book that provides some brain stimulation, but it's better if you can also be part of a book club and discuss that book or relate it to other things that you might have read or other things that you're interested in, where you're doing something with that mental information. That engages your attention, your associations or semantic networks, and really seems to provide the kind of mental stimulation that we know is important from a brain health point of view for anyone, particularly as you're dealing with the long-term effects of cancer and cancer therapy. Now, there are a lot of computerized programs out there that offer brain exercise. And many people ask me, should I get one of those? Is that important? And again, I think the answer is that if that's the kind of mental exercise you enjoy, if you find puzzles and games like that stimulating, you like competing against yourself and trying to get better at things, then absolutely those kind of programs can provide a valid form of brain exercise. But they're not necessarily required or going to be better than any other form of brain activity. So I don't want you to feel like you have to, go out and buy one of those programs to get your brain exercise. In fact, what we know about those cognitive exercise programs is that you will get better at those tasks, but whether or not it's going to generalize or affect your performance at other activities in your real life is a little bit more dubious. And of course, the companies that design and sell those programs have a different agenda, as illustrated here. The graph on the left just shows you the growth in the brain training industry over the last decade or 15 years, which has been tremendous. And in fact, one of the leading programs in this field was fined by the Federal Trade Commission for overstating the benefits attributable to their program in terms of scientific evidence. So I think it's a buyer beware kind of moment. Sure, these are great things. And for many people, they're a great option and kind of fun, but they're not necessarily your homework or something you have to do. If you'd rather crochet or join that book club or learn a new skill, those things are probably just as effective. Sorry. So, sorry, it looks like my computer jumped here. Want to just wrap up now and summarize that what we've covered so far today, and setting the stage for your next speaker, Amy McGuire. What I pointed out is that cognitive problems are a common issue that occur with brain tumors, as many of you know, and that treatment for those cognitive problems can be guided by using a developed understanding through neuropsychological evaluation of your individual profile. The treatments that we've talked about so far are things like medications and brain health activities. And next, after a short break, you'll be hearing a bit more about individualized strategies like cognitive rehabilitation. So I'll wrap up here with a disclaimer from the ABTA and simply thank you for spending some time with us here this morning.
Thank you so much, Dr. Parsons, and thank you so much for sharing with us the effects of brain tumors on daily life. That was really valuable. Attendees, please continue to submit your important questions. I see a few in there now. Feel free to keep them coming. Our speakers will tag team and answer all questions after the next sessions because the topics are very much related. We will have a very short break and meet back here on the hour. And our next session will be on cognitive rehabilitation. How can I make my day easier? We'll see you back in just a few minutes. Thank you so much. Welcome back. I hope each of you took a moment for a very quick break. I'm going to welcome back our chair, Dr. Logan, to introduce our next session and speaker.
The next session is titled Cognitive Rehabilitation, How Can I Make My Day Easier? Cognitive rehab aims to improve and restore cognitive function by relearning and retraining previously developed skills. Attendees will learn simple strategies to make your day-to-day life easier and be provided with tools to optimize your cognitive functioning and restore some independence into your life. Our speaker, Amy McGuire, is a certified speech-language pathologist and cognitive therapist dedicated to serving the needs of patients with brain tumors and their loved ones. She practices at Massachusetts General Hospital in Boston, where she has worked for the past 9 years across both inpatient and outpatient settings. She is a member of the Society for Neuro-Oncology and volunteers with the Boston chapter of the National Brain Tumor Society. I first met Amy through an educational journal club. I was immediately impressed with her inquisitive nature and her dedication to truly understanding the cognitive implications of our brain tumor treatments. If I were to need a cognitive therapist down the road to manage my own care or someone that I loved, Amy would be the first person on my speed dial. Please welcome Amy McGuire.
Thank you so much, Ashley. That was really lovely introduction. Thank you. I feel incredibly honored and privileged to be here with you all today. Big thanks to Ashley and also Emily and the ABTA for inviting me to speak. It's been great hearing about all of the amazing resources and programs that the ABT offers to patients, caregivers, and families, and from learning from the other speakers. So yeah, I am an SLP and a cognitive therapist at Mass General. I work primarily with adults with brain tumors, and I built a small team of speech pathologists that focus on providing assessment for patients, assessment and treatment for patients with brain tumors. And also we aim to better understand the experience of living with a brain tumor. And we also collaborate with wonderful colleagues like Dr. Parsons and his team of neuropsychologists and psychometricians. My only other disclosure is that I receive stock options as a consultant for React Neuro. So my goals for you as you listen to this presentation is to continue to think about this idea of cognitive domain, which Dr. Parsons presented so wonderfully about, right? Thinking about how those concepts of domain can be related to things you're experiencing in your daily life. I'm hoping we'll be able to recognize a difference between direct treatment and compensatory strategies as I talk about some possible strategies you might want to take into your own daily life. So first, I really want to acknowledge that cognitive change can be a little bit of a challenging topic to talk about for people. The bottom line is that cognitive change really is a personal experience, right? And as you listen to us talk a lot about these cognitive concepts, sometimes it can bring up thoughts and feelings that we don't really expect. And you know why? It's because cognitive function is often really tied to how we define ourselves, whether we know it or not, right? You might be a person who has always said, I consider myself really great at whatever, doing the New York Times crossword. Or conversely, you might also be someone who sort of identifies as, yeah, I've always struggled a little bit to stay organized, and that's just who I am. But regardless of how you're kind of linking your identity to cognition, right? If cognition is changing because of a brain tumor diagnosis or experience, right? It can really disrupt our sense of self. It can disrupt our sense of personhood, and that's hard, right? So when I talk about cognitive change, I like to recognize that we might be talking about it in different contexts. It could be temporary or transient, right? If you've just had surgery, the cognitive change you might be experiencing could be a little different than if you've been diagnosed and had a long history of treatment for a brain tumor, and then it's a little bit more chronic. But regardless of whether it's transient or chronic, right? We just want to recognize that thinking about this is actually a little bit tough work. And I hope you all give yourselves a lot of credit for being here to listen and kind of reflect. Okay, so along with this idea of cognitive change being really personal, we kind of have to recognize that in the course of your diagnosis or your treatment, right, that can really influence how much cognitive change shows up for you, right? So we can see here on the left, there's this nice straight path with, it's open, there's lush greenery. And on the right, we have this beautiful fall road, but there are lots of curves and maybe some twists and turns. In my experience as a clinician, as I began working with patients who have brain tumors, right, it seems like the curvy path tends to be a little bit more kind of associated with living with a brain tumor diagnosis. And I say that because it's sometimes helpful to draw a contrast. As a clinician, I see a lot of different patients who've experienced different things related to their brain. And having a brain tumor diagnosis, in my opinion, is a bit different than somebody who maybe has had a stroke or who has had kind of a one-time event, maybe a brain injury, where those things don't require the same types of treatment changes and regular follow-ups and ongoing scans that often is part of the brain tumor experience, right? And on top of that, your individual lifestyle and the things you're trying to get done in your day-to-day, right? These are also important factors that are personal. And so when you're thinking about, what does cognitive change mean for me? It's really important to think about those individual nuances, right? It's not as simple as saying, is there cognitive change or is there not cognitive change? When we're talking about a brain tumor experience, the whole arc of that really, as Dr. Parsons highlighted, it's likely that you might experience some cognitive change at some point. So we want to kind of demystify, and we don't want to make the experience of talking about cognition kind of a scary thing, right? So individual exploration is what I'm sort of focusing on here. Okay, but as I say that, right, individual kind of exploration of your own circumstances, that can be kind of mysterious. And from working with many patients, I often hear it, they kind of feel like, you're walking around a little bit blindfolded from time to time, especially if you're dealing with a new brain tumor diagnosis. Many patients are simply kind of reacting to what the doctors and the team are telling them they need to do next. And that can kind of be overwhelming and kind of difficult to tease apart, right? So navigating cognitive change, as we talk about it today, requires a lot of reframing and some flexible thinking around what we might really be talking about, right? I often hear patients say, life just seems a little different. If I feel a little bit off. And for patients and family members or caregivers and friends, right, it can be hard to put exact words to it because it feels sometimes difficult to talk about and really recognize what's going on, right? So as you think about making the day easier in this presentation, thinking about that individual exploration means asking, what is really challenging for me? What seems different, right? And you can kind of take down some examples. Sometimes that's a long process. You can't just do that, right this minute. You might start, but it can take many weeks and sometimes many months to kind of figure out what's going on with me. Thinking about your strengths and the natural things that kind of work for you and the people and the tools that you have. And then also being open to thinking about, what am I willing to change? What's really important to me? And I'm trying to deal with this idea that maybe I've got some change, cognitive change to reconcile. What am I willing to be flexible about? Okay, so I want to highlight that a lot of what I'm going to talk about has to do with compensatory strategies. And sometimes that's kind of a little bit of a foreign term, right? So when I'm talking to patients about cognitive rehabilitation, this compensatory approach is about kind of reframing, recognizing what's challenging and then reframing it to make those tasks easier to get done. This is contrasted with direct treatment, which is really about recognizing that something is difficult. And when we're directly trying to treat it, it's a lot about practice. Sometimes we're almost drilling certain concepts or tasks, and we're doing it again and again to see if we can make improvements over that specific thing over time. Compensatory strategies can work in conjunction with direct treatment, but they are a little bit different. And so we're often saying, how are we going to work around this challenge, right? What is a new or a different approach that I can use to accomplish the same thing, but in a different way? Okay, so we've heard about cognitive domains. We learned a lot about them already in the last presentation. And I'm going to generally kind of say that there are these buckets, and this is how I think about cognitive domain. It's nice to kind of say, oh, I'm going to look at each one separately. But the reality is when we're talking about the brain, they're all related. And Dr. Parsons highlighted a lot of that, right? He presented you some great information about speech and executive function, memory, all these things, but recognizing that sometimes if there's a small change in one, it can also affect a little bit of your experience in another cognitive domain, right? So understanding the cognitive domain that might be most applicable to you in terms of being vulnerable can help you maybe choose strategies a little bit more strategic, strategies strategically, can help you make good choices for yourself about how you might want to try making your day easier. I was going to tell you a little bit of what I hear from patients and how I link that to thinking about domain. So when patients come and say, I've gotten to this point in the day where I get foggy all the time, or I feel kind of scattered, or they say everything is just suddenly a mess. I'm usually kind of neat, but I just feel like I can't find anything in my house or on my desk, right? That often has a lot to do with attention. That's one of the fundamental kind of areas in which I work with a lot of patients. Attention, as we heard from Dr. Parsons, is also very linked to executive function. And so if it's a little bit more in that executive realm, and as we already learned today, right, that executive function realm is kind of large. It's about solving problems, getting complex things done. So there's a lot that goes into executive function. I will usually hear people say, things are just taking me forever. I'm usually so quick to do X, Y, or Z at work or at school, but I don't know, the last project took me 3 times as long and I didn't finish it. Or sometimes people will say, I did finish it, but the whole time I just felt like I wasn't on top of it, right? That usually cues me to think about executive function. If it's language or speech communication, hopefully it makes sense that I'm hearing people say, I'm having trouble finding words. And one of the interesting things I often hear people kind of phrase it as is, I can't remember words, but sometimes it really has nothing to do with memory. It has really more focus to do with language. It could even be that the language challenges that someone's experiencing is getting in the way of writing emails, putting text together. Sometimes even reading information becomes a lot more difficult when we're talking about language. Or we might hear like, I start slurring my words as I get later in the day. What's that about, right? Memory, if you notice, you kind of forget what you need to do for the day, or sometimes we even hear, I walked into another room and I couldn't remember why I even came in here. Or you've heard people say, we talked about this. Don't you remember? We talked about this yesterday. We made these plans and it's just difficult to recall. That's memory. And then visual, spatial, and perception. That can sometimes be a bit more the realm of my neuropsychology colleagues and occupational therapists. But in my practice, when I hear people talk about that, I'll hear people mention like I bump into things or I read things and they don't seem to make sense. It seems like there are some missing words on the page. Or we might even hear people say they get confused a little bit more than usual about navigating their phone or navigating a computer or a web page. Okay. So I'm going to dive into some kind of thoughts on strategies. And so this probably doesn't seem like I'm telling you anything new, right? Using a calendar makes a lot of sense if you're forgetting some events or some tasks. But the thing that I want to highlight here is that, the executive function and the memory pieces of using a calendar, the format is really key to consider. So we might have like a pretty typical strategy of mapping out things that we got to do on a monthly calendar like this. But if you're just finishing surgery or a week of maybe a clinical trial drug or a treatment, I often hear people talk about how they're a little more tired than usual for a week or two, or maybe something else has happened and you had a different medical procedure and everything just seems to kind of fall apart a little bit. Sometimes it's important to consider using a different format, like one that maps out hours in the day, so you can really see how much time are you budgeting and how likely is it that you're going to finish that thing, or using a weekly format so that you can put a little bit more detail in there, because sometimes you might need that extra recognition piece if putting just like a very short description in the monthly version doesn't offer enough context. The other thing with calendars is that it can be very helpful if you're not in the habit of using them constantly to at least set up a regular check either in the morning or the evening, knowing that, if you're not carrying it with you all day, you're at least reviewing like what's on my docket for the next day or the next week. If you have a friend or a family member who wants to support you in this, it can be nice to schedule a same time, same day type of check, just to kind of reorient to what's coming up. The other option is sometimes it's actually a lot to be individually expected as the patient to be putting everything in your calendar. Sometimes that's overwhelming in and of itself. And if that's true, electronic calendars where you share, especially if you have a smartphone or you tend to use a computer a lot, sharing access to a calendar and having family members or friends share that, people you trust, to put events in can be really useful. So it takes the responsibility away a bit. Here I have a little Google Calendar example where you can create up here a new calendar, or you can hit the plus sign down here. And then here I made a little test calendar. You can choose to share it with specific people. And so this is where you get to be discerning and exert a little control. You want people who are gonna be understanding and really support you when you're gonna share your calendar. You don't want to share your life with everybody. You can put it in here and then decide how much access you want to give them. And that helps share the burden of remembering to put things into a schedule. So if somebody else is doing it and you can set a little alarm, that might help you feel a little more successful with knowing what's going on. Sometimes it's actually not so much about knowing that you have an event, especially if it's an event that has a very specific day and time. That's like calendar stuff. If you're having a little trouble kind of remembering small tasks, small errands, things that don't have to happen on a very specific day, but could happen just sometime that week, sometimes I recommend people think about a one notebook sort of strategy. It's a little bit like a bullet journal, and I know some people feel if you know what a bullet journal is and you've tried it, some people say like absolutely not, it's too complex. But other people may not be familiar with bullet journals, and here's a little schematic to present the idea. So the idea is that you kind of put one day on every page and you're just listing out the things that you'd like to get done, or you think sometimes you're putting events like this here. And then as you finish things, you're going to cross them off, right? And here I kind of cheated and put a second day on. but I've added a whole bunch of other things. And if I'm getting things done this day, I'm also recognizing I could do errand 2, which didn't get finished yet, or task 1. And oops. As I finish things, I cross them off. Okay, so the next day I need a new page, right? But in order to avoid having to flip back and forth and keep track of many, many things building up, I'm going to look at my other page and recognize the things that didn't get crossed off. I'm going to migrate them over to my new page, which is Wednesday. And then I never have to look at this page again. So the idea is to kind of help manage our executive function and memory vulnerabilities potentially through this strategy by keeping only what I need to focus on today on the active page. Another thing that I really commonly hear is that a lot of people come in and say, I've got, I don't know, I love sticky notes. I've got them everywhere. You should see my desk. But then a lot of people will also say, but I don't know what's on them anymore. And I jot notes down, you know, as I go throughout my day on the back of envelopes or whatever scrap paper is available. But I have this mound of notes and I don't know what I have to do. One step towards organizing a little bit of that is to try and get away from sticky notes. So as much as I love them and I still use them myself, if you put something on a sticky note or you jot something on the back of an envelope, like rip it off and paste it in your notebook. The idea is to keep everything in one place and to not have kind of a lot of different pieces of information spread out in various corners of your life. So you can put, you know, your grocery list, errands, shopping lists. If you're trying to remember certain people names or places, you can put that in the notebook too, right? And you have options to kind of use a bigger notebook or a smaller one if you want to take it with you all the time or carry it in a bag with you. That's your choice to consider. And this is kind of crossing a lot of different cognitive domains, right? We're trying to keep our attention focused in one place. We're trying to stay organized and touch on executive function that way. And then memory, we're writing everything down so we don't have to hold on to it in our minds all the time. We can look back. Another really important aspect of making the day easier is building a bit more routine. Some of us pride ourselves on not having a routine, right? We can like be really get up and go and spontaneous, but we might need something like a launch pad if we're constantly forgetting our wallet, keys, or cell phone. Another idea is to break up the day and try to assign one task to each segment of the day. So I often recommend that people map out early, late morning, early afternoon, late afternoon, and evening, and just try assigning one thing if you're struggling to get things done during the day. The other piece here is medication, right? Obviously, if you have a lot of medications and it's difficult, use a pill box, but creating additional routine around filling that and building that routine with someone else can also be kind of helpful as a ritual. Here's a little example of the launch pad. Oops, it's not advancing. So the launch pad, you can take a lot of different forms, just lay things out or have a basket, or you might have one specific slot for everything that you label. But the idea is that every object needs a specific home. That's really important. Putting a process on paper in small steps. So this is a little bit related to breaking things down into smaller chunks, right? Like I was talking about in the day. This is actually really important from an executive function point of view, because a lot of these planning of events or planning pickups for your kids or something like that, right? That tends to break down a little bit when executive function is vulnerable. So the idea is if we can map it all out and complete one task at a time according to your list, it makes it a little bit more efficient. Right? Here's an example of trying to bake brownies in 5 simple steps. If I look at step 1, in reality, it's actually several steps. It's 6 different steps, but they're saying it's 1, right? And if I do this down the list for other steps in the recipe process, I can actually break it into another 6 steps in that last process. So in reality, baking brownies is not 5 steps. It's probably at least 15. So seeing this visual breakdown can be really helpful. When we think about increasing the right signals, sometimes we're acknowledging that we want to have more signal, right? So maybe in this case, when we're talking about language, we want more language and more words, or we might want less. But if we want more signals, we need to ask for more repetitions. Other people can repeat back information. You can be repeating back information to other people to verify that it's correct. And then using some self-advocacy phrases is a big part of this, right? So letting people know, I kind of want to have notes from this meeting. Could you send me the information after we discuss in writing? If you want to take the notes, a lot of times it's really helpful to ask for some quiet time as you're writing the note, rather than have somebody continue to talk. And obviously asking for a few additional seconds to find words rather than have someone jump on you with that possible word is helpful. Using recordings and voice memos can help whether you're trying to remember information that was said to you, or just to prepare what you want to say, making a little recording and then playing it back later. That's another option as well. If expression is your challenge, maybe scripting it out is helpful, right? And sometimes if we're in a really noisy environment, just being prepared with earplugs or noise canceling headphones can actually help you hear your own thoughts better and let you focus on developing your message. Same thing about the signals for visual information, right? Sometimes visual information needs to be boosted by having like a brightly colored background for a reminder sign. Thinking about where you're going to place your reminders is important. So putting it at eye level is important. And then recognizing that it's these transition moments, like when you go from the car into the house, or you're about to leave the house, or you're talking to one person and, you know, doing something in the kitchen, and then you're going to move and do something else. That's also a transition. You might need some visual cues to keep you on task. So here, you know, this person has a doormat that actually says, don't forget, they've merged visual cues and Launchpad. And again, noise canceling headphones, if you're in a very busy environment, like let's say you're at the airport and you need to be searching for something important, like a sign for your gate, sometimes when it's noisy and there's music playing, it's not helping your visual search. So you want to dampen the distractors, put on those headphones or earplugs so that you can search more efficiently. Same idea here. So sometimes the visual distractions actually are the things that need to be dampened, and you might want to think about always having like a hat with a brim if you're in really bright settings, especially after surgery, or having like tinted glasses. Okay, 2 more slides. I'm a little over, I'm sorry. Managing your cognitive fatigue is a really key piece to making your day easier. So I recommend people think about having brain breaks, right, throughout the day. They can be short, 2 to 5 minutes. And the opportunity is really about decreasing stimulation, right, to cycle down how much you're thinking internally or how much you're exposed to like a lot of noise or visual stimulation. So the keys here are change your environment, right? Taking a walk is a great activity to also draw on that strategy of physical exercise that Dr. Parsons mentioned. Change your body position, or at least change your physical view in the room if you're trying to take that break. And one really important idea is that if you notice that cognition is a little bit fluctuating for you, there might be windows of the day that are better to do things than others. So if you wake up in the morning and you feel pretty bright and clear and ready to go, doing some of the harder tasks in your day are going to be better early rather than late when you're likely to be a bit more tired. And napping is also a really important thing. So if you have the ability to take a nap in the day and then do that difficult task, that can be helpful as well. Finally, accommodations. Accommodations can be a really significant piece to help improve your experience with cognitive change at work or in school. And accommodations usually are highly individualized to address whatever it is that you're experiencing as challenging in either of those settings, right? Generally, I've listed a couple things here. Accommodations can help reframe employer and colleague expectations around the timelines for what you're going to be delivering. It can help specify formats that work better for you to deliver information or to receive it. Compensatory aids like text-to-speech dictation software or Speechify, where it will read things out loud to you, that can be useful. Prescribing brain breaks and letting employers know you need a break of 5 or 10 minutes after every presentation, which I'm probably cutting into right now. I apologize, your break. Formalizing expectations about whether you could attend in virtual format by phone or video. Flexible scheduling around ongoing medical appointments, and then just other guidelines that set expectations for how you're gonna operate in that work or school environment. And if you need support for accommodations, getting a neuropsychological evaluation, seeing a speech language pathologist like me or an occupational therapist, and also talking with your oncology providers can be really important to support the process. All right, I apologize for going over. here's our disclaimer, and I welcome you to contact me directly on Twitter or email if you have questions beyond this conference. Thanks.
Thank you so much, Amy. That was a wonderful session just to hear about the strategies to improve and restore cognitive function. Thank you so much, Dr. Parsons, for joining us back. We will now transition into the Q&A portion. We already have some great questions submitted. We encourage each of you to continue to submit your questions to both Amy and Dr. Parsons, and they will tag team and answer them. All right, I'm going to welcome back Breen, and she's going to read some of our questions aloud. Thank you.
Thank you so much. Just as a reminder, if you have a question that you'd like to ask, please type and submit it using the Q&A button on the bottom of your screen, and we'll answer questions as time allows. All right. So one of the first questions we have here is asking about, the different lobes and the functions. So if a patient were to have surgery in either the right temporal lobe or the left temporal lobe, is the hippocampus also affected? And if so, does that then impact the patient's short-term memory?
Sure, I'll take this first if that's okay, Amy, but feel free to chime in. It depends a little bit. The hippocampus is in the temporal lobe, but the temporal lobe itself is fairly large. And so you can have a tumor in the temporal lobe that doesn't touch the hippocampus. But oftentimes, even if the hippocampus itself is not impacted, the connections from the hippocampus to other parts of the temporal lobe can be. So it is common when there are tumors in any part of the temporal lobe, especially if they do directly involve the hippocampus, to have trouble with short-term memory. And by short-term, again, a lot of what we're talking about is recent memory. But keep in mind, again, this concept that both Amy and I have talked about is that there's so much interconnection between brain areas that it's usually not just memory that you'll experience a problem with, but you may also notice problems with attention or speech and language and other elements. But the memory issue itself is very commonly associated with those temporal lobe tumors, particularly when they involve the hippocampus.
Thank you for sharing that. Dr. McGuire, did you want to add anything to that?
I will just say sometimes it's kind of helpful to think about what else is going on if you have questions or concerns about the hippocampus, right? So if you have, if you've noticed or been told there are some memory challenges and you've heard the word hippocampus or temporal lobe kind of thrown about in the context of a new diagnosis, sometimes someone might have a tumor in the temporal lobe, and before you have surgery or any treatment on it, there's something we call mass effect, right? Where it's irritating the tissue around. And it might be impacting the hippocampus at that time, but it's maybe not primarily going to continue to impact the hippocampus, right? So kind of just recognizing that there's a little bit of variation and that people might be talking about the hippocampus, but those memory challenges might actually ease up as you get further away from surgery.
Thank you so much, both of you, for those wonderful answers. Keeping with the theme of memory, how can a patient or you as physicians understand if the deficits that they're experiencing in cognition is due to the brain tumor and treatments or just aging? And this would be, of course, for patients who are a little older. And does it matter? Does that impact how you would manage those side effects and symptoms?
I think it's certainly an important factor. So yes, it matters. And it can often be very difficult to tease apart the effects of normal age-related changes in our memory from those effects that come from a tumor or treatment, especially when you get into the years of living life after surgery or radiation or chemotherapy, where, the whole point of doing all that treatment is to be able to age. The downside of being able to age is that your memory is going to go downhill. It really does happen naturally and normally. So oftentimes, one of the reasons that Amy and I like to get involved in helping people from as early as possible when you're dealing with a brain tumor is to establish an understanding of what your pattern of strengths and weaknesses is at that stage, and then to be a member of your team going forward, hopefully on a long journey that involves talking about the effects of aging on your memory. That's the goal, right? So we often use assessment over time and the specific pattern of strengths and weaknesses to help separate out the effects of the tumor itself from the effects of age. But the more that we're on board early in your care, the better we're going to be able to help you understand what's happening, how are things changing, is that reflecting the tumor or the treatment, is that a normal age-related change, all of which then we can work with you on to try to mitigate the effects of those changes on your daily life.
Yeah, I second all of that for sure. And the one thing that I can say is that this is a fairly frequent question that comes up for folks. And a lot of times it is that assessment over time. So in the moment that you're dealing with a new brain tumor diagnosis, even that whole first year or sometimes even more, it's really difficult. We probably won't have a definitive answer to say it is or isn't aging related. But over time, that's why it's important, even if you start out having assessments with a speech pathologist or a neuropsychologist, years down the line, if you haven't maintained that connection, it's great to ask again to have a reevaluation, hopefully with somebody who has seen you before. But if not, it can just kind of be helpful to get another voice and kind of hear what they're saying about what they're seeing. But I really emphasize that it's a lot to do with knowing what your pattern of strengths and weaknesses are, is like Dr. Parsons mentioned, and working within that to kind of answer the questions as they come up. Because again, as I mentioned, talking about cognition feels a little bit scary and brings up a lot of apprehension for people. And our goal is to help you feel really supported and to just have a place to ask those questions.
Thank you so much for sharing that advice and insight. Another question we have here, we have a couple of questions on this same topic, is regarding treatment. So if a patient is experiencing cognitive effects due to the tumor, once the tumor is removed, would those effects then be alleviated?
I'll jump in. So it depends a little bit on the treatment, but by and large, yes. My work focuses a lot on seeing patients in the context of surgery. And so a lot of times there can be, I would say, worsened or more noticeable cognitive changes at hand before that tumor has been subjected to surgery or some other treatment that's designed to shrink it. Because until treatment begins, there's a lot more potential for irritation and swelling and other things to happen that are clouding the picture and making some cognitive vulnerabilities maybe seem worse. Overall, I think my answer is usually yes. We expect some improvement, but after even surgery, there's some natural healing and recovery that is just associated with purely having surgery that is also in the mix too. So it's a little bit hard to kind of say absolutely it improves for everyone. As many people may also know, right, there's some elevated risk in certain cases to also have some seizure activity, and that can sometimes cloud the picture too. So it's important, if you recommend it to stay on some anti-seizure medications, that really gets controlled and addressed.
Thank you so much, Dr. McGuire, for that answer. All right, another question we have here is regarding finding speech pathologists, cognitive therapists, those people who will really help in your rehabilitation process. Can either of you share resources or places that patients and families can go to find these individuals in their area?
Well, I think in the opening session, Mindy Freund talked about just such a resource offered by the ABTA. In full disclosure, I have not looked over that resource finding webpage, but I think organizations like the ABTA can be really helpful for individuals who are trying to find specialty sites which really have a deep level of expertise in brain tumors. It may be that you can get a lot of the treatment you need close to home at a smaller center, but for some specialized issues or problems, it can be helpful to go to some of the larger centers for certain kinds of evaluations. So certainly look for that and talk with your neuro-oncologist about the kinds of concerns you have and where they might go themselves or suggest for those resources.
I will add that I do think that finding therapists that are affiliated with maybe larger centers that have kind of wide neuro-oncology practices or well-known neuro-oncology practices might make it easier to find therapists that are specifically familiar with a brain tumor diagnosis. That is an important piece in my opinion. But also really, we have circumstances that we sometimes can't change, right? Distance from certain medical centers, the convenience of getting rides and things, right? So, if you are going to seek care closer to home, I really encourage people to recognize if they don't feel like they've got a great fit with a certain provider, it's okay to say, this isn't working for me, I need to look elsewhere. And it's also okay to ask your provider to kind of recommend somebody else. There's somebody else in your practice, I'm not sure we're a great fit. And it's really our responsibility to kind of say, okay, sometimes that comes up and maybe you need to see a different provider. Not all speech pathologists are the same, not all occupational therapists or neuropsychologists or physical therapists are the same. So, that's your right as a patient to kind of have that conversation and make a decision.
Thank you so much. And I do encourage any of our attendees who have questions about finding support and resources to contact the ABTA Care Line at 886 at 1-800-886-2282, and we'll be happy to help find you and connect you with those resources in your area. I think we have time for maybe one more question. And this may be a good segue into one of our later sessions. So we have an attendee asking, can brain tumor location and subsequent treatments affect emotions and your mood as well as your cognitive functioning?
Absolutely. I'll jump in first here. So, we talk about feeling from the heart and thinking from the head, but of course, your emotions come from the same place as your cognitions, the brain, and anything that affects the function of your brain can affect the tone of your emotions, the regulation, personality, style, emotional reactions in a number of very difficult to predict ways, highly individual. So we know that there are certain common things that people experience. They may have a flattening of emotion, or they may have the opposite, where emotions run on more of a roller coaster and it's harder to control your temper or your tendency to break into tears or feelings of panic and anxiety. There are also elements of personality that can be affected by the tumors or treatments, such as insight, judgment, interpersonal interactions. The way you express emotions in your voice and your face is often also affected. So absolutely, emotional changes can be direct consequences of brain tumors. Of course, there's also the stress of dealing with this medical situation that is going to have an impact on how you feel and how you react for many of us as you go through the journey of dealing with a brain tumor. So disentangling those direct influences of the tumor itself with the very normal reactions and adjustments you have to go through is often part of the discussion in our evaluations and in the therapy.
I absolutely agree. I think the general answer to the question, I think, is basically yes. Like, your emotions can certainly be affected by a brain tumor. And one of the concepts that I like to think too about is really trying to make embodied decisions. Meaning, I talk a little bit about this 3 brains concept. It's not mine. I heard it somewhere else. But we have our brain, we have our heart brain, and there's a lot of research talking about our gut brain too, and how the digestive system is connected through a variety of nerves, right, to the brain, right? And sometimes we need to be checking in with all 3 to really see, like, how are we responding bodily and holistically to what's going on around us. It's not sometimes like adequate to just think, oh, I'm going to look at this through the cognitive lens. Really thinking about how it's affecting you in these other 2 kind of brain areas can help discuss a little bit more about what you're experiencing and give a framework for letting other providers know, like, I'm not quite feeling like myself. I'm thinking just fine, but something here and here feels off. And that can be a good way to kind of start addressing some of those emotional concerns.
Thank you both so much for those answers. Unfortunately, that is all the time that we have to answer questions live. Our presenters will stay on and try to type responses to any of the questions in the Q&A button. And I'm going to go ahead and turn it back to Emily, and we'll move forward with the rest of the program.
Yes, thank you so much, Dr. Parsons and Amy, for this wonderful session and sharing with each of our attendees your insight and expertise on how to ultimately improve cognitive function. As Ambreen said, our presenters will take a few minutes to answer some unaddressed questions live. For those of you who need to take a short break, please take this opportunity to stand up, stretch your legs, use the restroom, grab a snack or a beverage. And we invite the rest of you to stay on to hear from our sponsors who will share about what resources they offer to patients. We will resume the program in about 12 minutes for our next session on the emotional journey of a brain tumor. Thank you all so much. See you back soon here.
One of the best things about Optune is I can get my treatment at home. I don't have to go into a hospital for any other kind of treatment.
During these challenging times, Optune is a treatment that patients can use in the safety of their own home.
Daryl's treatment for GBM continues, but it looks a little bit different these days, doesn't it?
Yeah.
So Daryl gets his MRI done, of course, in-house with all the precautions that hospitals are taking, but everything else has been telehealth. So he's met with his whole medical team now just virtually. But the one part that his treatment that continues unchanged is his use of Optune.
With Optune, I do all of my treatment at home. I have telehealth meetings with my doctors. So the only time I really have to go to the hospital is for my MRIs.
We continue to get our supplies. We continue to upload our data and switch out units just as we always have. So that Optune is something we've been able to continue at home, unchanged.
We'll have all of the supplies that they need delivered directly to their home. And the device support specialist can also help support the patients either in person or virtually.
We live in a very rural area, and you can almost count on one hand or maybe two how many radiation therapy centers there are. There are not very many. So I think for us, it's been really helpful being in a rural environment that we don't have to worry so much about when or where these people are going to go for their radiation.
This gives them an opportunity to get their radiation kind of in a one-stop kind of fashion versus multiple appointments and trips to Greenville.
One of the things I was really excited about initially with gamma tile, because it's brachytherapy, it's actual radioactive sources delivered to the surgical cavity, it's inside out.
Gamma tile is different from traditional radiation because you don't have to come in day after day for repeated treatments. It's also delivered directly at the time of surgery.
In the patients who have gamma tile, the surgery process is not really much different. You put the tiles in, the radiation starts immediately, and they don't come back and forth like we're used to for their conventional radiation. And many of them had 30, 35, 40 treatments. They don't have to do that.
This is something that I can hold in my hand and say, this is how it's delivered. You know, the radiation beams are inside the tile and they're physically implanted at the time of surgery.
Now, having an actual radioactive source, the dose fall off is so fast from that surgical cavity that large parts of the brain that otherwise would get radiation from external beam techniques get no radiation at all.
It's a great option for those patients who, you know, have already had radiation and failed it. It gives them an extra option.
All right, welcome back, everybody. I hope each of you were able to take advantage of that quick break. We will proceed with the rest of our program. So brain tumors not only affect the mind's ability to function, but can also have an effect on emotions. In this next session titled Brain Tumor, The Emotional Journey, attendees will explore the common areas of distress during the brain tumor journey, learn how to enhance emotional well-being, and extend quality of life. I would like to welcome our chair, Dr. Logan, who will give an overview of this session and also introduce our other presenters. Thank you so much.
Thank you, Emily. I am excited to transition over to now the emotional experience of our brain tumor patients. And I'm extremely honored to jumpstart our session today, actually talking to a patient. We have here with us, Steve Archibald. Hi.
Hi, everybody.
He's known by his friends and family as Archie, so we will call him Archie. That is his nickname. Archie was actually diagnosed with a grade 3 anaplastic astrocytoma back in October 31st of 2011. So he is a long-term survivor and a prominent advocate for the brain tumor community. We welcome you today, Archie, and I see you are joined by your beautiful wife, Sarah. We thank you both for your willingness to share your journey with us and to talk about the emotional journey of being diagnosed with a brain tumor.
Yeah.
So I would love to just ask you a few questions, share what you feel comfortable sharing with our audience, just so that they can hear from your perspective how you have managed the diagnosis and what has helped you the most. So I would love to start off by asking you, Archie, what did you feel when you first heard there is a tumor located within your brain?
It's a great question. Thanks for having us here today, first of all. And to everybody out there, I hope you're getting inspired and get some hope from today. I was diagnosed on Halloween, so it was probably the worst and scariest Halloween I've ever had. But I was having a lot of patients have seizures leading up to their brain tumor diagnosis, and I did not. I just had some vision issues, but it pushed me into going to the doctors, and we did blood work, we did everything, and then it was just a last ditch effort to say, oh, let's get an MRI, make sure everything's good. I did that MRI. I walked across the street, and before I even got back to work, it was my neuro-oncologist saying, we found a brain tumor on your scan. So there I was in the middle of Washington, D.C. I just fell to the sidewalk. And then that, rushes back in your head. Do I go to work? What does this matter? So first person I called was Sarah, who we were just dating at the time. So that was not the best thing to deliver. So Sarah and my mom were the first guinea pigs into my purview of brain cancer. And so that first emotion I felt, I think, Ashley, was just shock. And I think all emotions flow at that point. So you have shock, disbelief, sadness, self-blame even, because how did I get this? What did I do to cause this for myself? But all of those things kind of came in, and that roller coaster initially of just all of that emotions is so quick. And then having lived 10 years now past that day, which I never thought I would, those emotions continue. They don't go away. So once you get on the roller coaster, it's one ticket, you're on it for the rest of your life. And some days and a lot of days are amazing. And some moments of days are just really sad and kind of perplexing to wrap your mind around. But it's a long journey for me, especially. And there's not a day where you don't feel emotion. They don't remember they have a brain tumor. But the initial was just abject shock. So.
It's interesting you say that, because I'm going to speak about that in my presentation, this overwhelming shock and disbelief, right? And then you talk about this roller coaster, which is also in my presentation. So it means that we have a shared experience here of what I'm hearing from my patients and what you're experiencing. But the highs, right? The great days where everything is working beautiful and you're making memories with your family and you're going through these milestones. And then you talked about the low days and maybe even the days that have some loop-de-loops, right? That you go high and you go low and back and forth. What out of these last 10 years stands out the most as the most distressing emotion that you have had to battle with or overcome throughout your trajectory?
There's two that I'll combine.
Okay.
One is having this diagnosis and being told my time was probably most likely going to be shortened, and shortened by a lot. I was 32 years old at the time. I just started dating my now wife. My dad passed away from cancer 6 months before I was diagnosed. So there's a lot of things that were happening, but you have those emotions of, okay, this happened to me. Do I drag anybody else into this mess? Is it fair to make a proposal to my wife to marry me? That first initial emotion going back and forth, and I hope Sarah doesn't mind, but I proposed to her, she said yes, and then I tried to break up with her right after that, because that feel of like you're pulling somebody into something that that's going to be tough for yourself, and why put that on somebody that you just care about more than anything in the world. The second one kind of goes along with that too, is I know about this now. I don't know how long I have to live. And we had talked about raising a family and trying to really unpack all of that emotion. What if I pass away? What does that mean? What if I don't? But what if I become to a point where, we're talking about cognitive abilities today too, is like, what if I can't speak? What if I can't read, write? What if I can't do all those things? That being an attorney, that's my profession, is important, but also like, I want to read my kid a bedtime story. So we went back and forth, and I did a lot of mental exercises, emotional exercises. And now we have a healthy 2.5-year-old boy, Dylan, that sorry, I wouldn't trade for the world. So
That was beautiful. Thank you. The experience that you're talking about, I think has a term actually, and it's called double awareness. And it is this seesaw in this balance of trying to navigate, how do I live my life meaningfully and purposefully, right? With goals and milestones and drive and ambition, the way that I was prior to diagnosis, while also now holding on the same journey, this idea of an incurable to date disease. And how do I live every single day holding both truths? Because that's what a survivor does.
Yeah, it's an interesting kind of, polarity, if you will, is that, I'm extremely lucky. I'm extremely grateful. I go through the same normal troubles that everybody does every day. It's just with the added beauty of side effects from chemo and radiation that I have every day, every moment of my life, that I don't need to share with people. That's my journey. And I try to put on a face each day, knowing that I have to function in a world that doesn't see my disability. The only thing you can see is maybe a scar on the side of my head. Sometimes I'll have some speech issues. Sometimes I'll have some writing issues, but in the main scheme of things, you don't want to be in this position. I don't want to be in this position. So I'm trying to live a life that you want to hold on to before. And I've written about this and I've talked about this before. And it's like, it's a new normal. And it's really trying to figure out who you were and who you are now, and really rectify the idea that you're the same person. You may not have the same abilities, you may have other abilities, but trying to live in a world that just is so fast paced, trying to keep up, trying to be an attorney in a corporate law firm in DC. That was a turning point for me. It's like, what am I doing with my life? It makes you take stock, instead of just tomorrow's Tuesday, tomorrow might be the only Tuesday I have. And it's that balance of kind of putting that into a short-term frame, but also a long-term goal. And it's not easy, and it's a daily thing. 10 years later, it's a daily process. But I think the one thing in my takeaway is attitude. And I think that goes across both polarities, and that if you have as much as you possibly can a positive attitude, I think that's some of the best medicine that you can give yourself. No matter if it's during treatment, post-treatment, during surgery. And we can't be positive all the time. We look at, brain cancer, and that's not a positive thing. But I look at things that make me happy. I look at things that just kind of bring me joy. And I just do this every day. Just a little pinch. I'm still here, still kicking.
You are.
That's the point. So
I love that. And you kind of answered a little bit of my next question. It's so profoundly, was how have you managed over these last 10 years holding these emotions? I mean, they're heavy, they're hard. And how have you been able to navigate that road? What programs have been beneficial to you? I know that you are, obviously very involved with the ABTA. And are there any pearls of wisdom you would love to embark on our audience right now before I jump into the presentation?
Yeah, I think I think you have to lean on people. I mean, I leaned on Sarah more than a human can kind of take. But you're in this together at that point. And but I'd say just kind of, trying to just be yourself without the added pressure of, being a brain tumor patient and all these things. I love to kind of carve out the idea that I'm a human being with a brain cancer. I'm not a patient. And I kind of look at the word survivor, and I want to switch that with thriver, because
I love that.
We're all here, we're all surviving, but it's what you do with your life after this, that will determine kind of who you are, what you want to be. You have to really focus on all that stuff. But I think really kind of just using your resources. I became a big ABTA mentor for people that have same kind of brain cancer that I have. I find that valuable not only in helping people, but it's such a important thing to me to kind of give back. I have something that is rare. I can hold it to myself and just let it be mine, or I can share it with the world and just hope that in sharing it helps other people. So we could talk all day long, but I'd love for you to get into your presentation, answer any questions that might help too.
Well, Archie, thank you so much. You are truly a thriver. And Sarah, I thank you for sitting alongside your thriver and your husband. I know we will be touching base with you a little bit later when we talk about the care partners perspective. Thank you guys again for being here. It is invaluable to me as a professional, and even more so invaluable to our audience members.
I appreciate you having us. Thank you.
Okay, I believe it is my turn to now jump into my presentation. So as I described before, I will be focusing on the emotional journey, what I have learned from my patients over the last 7 or 8 years, what they describe to me that they're experiencing during this disease trajectory. And then I will segue over to my colleague, Alvina, who will follow up with strategies, coping, resilience, ways that we can help manage this emotional journey that we are on when we are diagnosed with a brain tumor. So the only disclosures I have is the financial support I received for my research, my academic appointment. And so I do receive funds from the American Cancer Society, the American Psychological Foundation, NRG Oncology, and the Department of Defense. And I actually need to thank them because they're the reason I'm able to create programs to better serve our patients, especially through their emotional distress. The objectives of my presentation today is I want to discuss the need for a platform for our patients' voices and how that has actually propelled my work. And then the majority of my conversation is actually going to be talking about this roller coaster that Archie discussed of emotions. These are the emotions, and I will go through each one of these through my talk, that our patients really describe throughout their disease trajectory. And I'm going to hit upon each of them, discussing not only what our patients tell us they're experiencing, but also what the research and risk factors of these different areas of distress are. So first, we're going to talk about the platform for patient voices. So we know, as a cancer survivor, or thriver, as Archie actually designated, which I love that term. I'm going to switch this slide in my next presentations. You have a lot coming at you at once. And there is a model called the biopsychosocial model that really depicts the different areas of stressors that are placed on you when you hear that brain tumor or just tumor cancer diagnosis. So first, we have the biological aspects. We are dealing with the tumor and its effects. We're dealing with all of the treatments, ongoing treatments. We're dealing with still trying to keep up with our general health, aging, and any comorbidities that we came into the diagnosis with. Did we already have high blood pressure? Did we already have some generalized anxiety? Are there other issues that this is just compounding upon? Then we're dealing with the psychological aspects, which is what this presentation really is focused on. So how are we emotionally adjusting to the diagnosis of a brain tumor? And how does that impact our day-to-day life, our relationships, our communication with others? And then obviously we can't forget about the social aspects that are part of all of our lives, right? We have socioeconomics. I was just diagnosed with a brain tumor. Am I going to be able to work? Am I going to be able to save for my kids' college? Do I need to go out on disability? Is my loved one or care partner going to be able to work? What social supports do I actually have in place? Do I have a spouse that can help me, or am I single? Do I have family and friends I can call upon to support me? And then lastly, of course, access to healthcare, which Dr. Parsons and Amy touched upon. Not everybody is lucky enough to live in the same region as a large academic medical center that has its own division or department dedicated to brain tumor survivorship and quality of life. So what is the access to be able to get medical treatment and or psychological and cognitive treatment? We know that distress is high across the board in patients that have tumors found in their brain or their body. But our patients with these brain tumors are at higher risk. And why? There is a high certainty, we know, of the tumor progressing. So there's a continual fear of that. While our scientists are ever searching for this cure for this life-threatening disease, to date, there is no cure. And patients are told that typically at diagnosis. And obviously, as Dr. Parsons and Amy talked so eloquently this morning, there's a direct impact of the disease and its treatments, not only on your thinking, but on your emotions. And both of those impact a person's quality of life. To date, there is no standard of care for supporting mental health in neuro-oncology. And I think when I started this career, I would have said, this is my professional goal. And now after working with people like Archie and Sarah, and the many patients that I've had the privilege to walk alongside with, I now say this is my life goal, is to ensure that mental health, cognitive, emotional, quality survival is standard of care in neuro-oncology treatment. So I started off with years of the typical research, which is what's in the literature. Here, fill out a questionnaire. What's the prevalence of these distress domains? And through my clinical work, I realized that it wasn't giving me the information that I needed. And it wasn't necessarily helping my patients. And so what I decided to do was open up a platform at my institution for our patients to come and tell us their stories. Tell us their experience of thriving through a brain tumor, the ups, the downs, the loop-de-loops that we talked about, and really give them the opportunity to teach me and my team what they needed help with and where we needed to focus our treatments on. I had them come in groups, talk to each other, talk to me, because they're the experts. while I work with brain tumor patients every day, I have not lived that experience. And so I ensured that our patient voice was the one prompting our future in creating better programs. So I wanted to set that platform because throughout my presentation, I'm going to show you some quotes from these focus groups. So you can hear the voices of our patients, and hopefully it will resonate a little bit with some of the things you guys have experienced in the audience. And it is helping guide our treatments for the future. So we are now jumping into that roller coaster of emotions. And as Archie so eloquently stated, my first slide is on shock. I had a 52-year-old female diagnosed with an astrocytoma say to me, I think especially with the shock of the diagnosis, just trying to figure it out. You sit here with this freaking book saying, make your decision. Choose your surgeon, choose your blah, blah, blah. And it's just, wait a second, your whole life has changed. Shock appears to be the initial emotion experienced not only by patients, but also their loved ones. If you think about it, no one grows up and goes through adulthood thinking, I might be at risk for having a brain tumor one day. There are, the prevalence rate of breast cancer is much higher. There's a lot of publicity around other cancers. There is screening implemented into women's care to ensure that a diagnosis is uncovered early. But there is no routine care for checking for a brain tumor. There is no necessarily that we know of risk factors that it's like, oh, you lived in a house on this street, or you had this experience, you're going to have a brain tumor one day, or you did this to yourself, like Archie was talking about. So it truly is a, wait, what moment as soon as they hear that term, you have a brain tumor. And then there's this rapid transition period of a couple weeks where everything is like lightning speed. I think of Star Wars, like the warp speed. That's what my patients describe to me. Their symptom onset is usually sudden. They have a seizure, they have vision changes, they have a headache that it lasts 3 days, and they go to the doctor and say, something is wrong, something's going on. MRI, diagnosis of brain tumor, or at least an identification of a brain mass. Within days, our patients are rushed into the hospital for surgery. And then within 2 weeks are told, this is your treatment. You're going to have radiation, you're going to have chemotherapy, and you better buckle up because this is your future. There is this overwhelming process of medical decision-making placed on these patients and loved ones within a moment time. 50% of patients with brain tumors describe this diagnosis event as a traumatic event, similar to someone who has some kind of trauma in their childhood, or a gentleman that went to war, or a woman that served our country and went overseas. The same kind of trauma our patients describe during the diagnosis time period. And many of them explain that at that time, they're just living in survival mode, being told what to do next and just following the path. Another area of distress that our patients describe is irritability. A 48-year-old female patient of ours who was diagnosed with an astrocytoma said to me, I have a problem with remembering certain words. I'll get frustrated because I don't remember a simple word that I should know. I get frustrated and I get angry and I just feel like I'm stupid. This symptom, psychological emotion, irritability, frustration, was the most commonly endorsed symptom across all of the focus groups that I have completed. And this irritability comes from many different areas, this frustration that my patients describe. Cognitive changes, which we spent the whole morning talking about. Patients are so frustrated that their brain is not working as efficiently as it once was. All the while they're trying to adjust to this diagnosis, right? They're being told that your future now includes all of these treatments, all of these medical appointments. And what does that mean for your life? And like Archie said, is this going to mean a shortened lifespan? Financial stressors are also at the forefront of our patients' frustration. They talk about, I think I said in the beginning, they talk about this concern of, am I going to be able to work? A lot of people find their identity in what they do for a living. Am I going to be able to provide for my family? Will I be able to save for my kids' college education? Will I be able to plan for retirement for my family, whether I am here or not at that time? And then these are also on the caregiver's mind too, right? Does the caregiver need to stop working in order to help care for the patient and help them thrive through their journey? And then, of course, family relationships and issues. We know that communication is at the forefront of our relationships. And when we're having cognitive changes, when we're adjusting to this diagnosis, sometimes those communication patterns can break. And we need help putting them back together. So patients and loved ones get very frustrated in the ability to communicate these changes, communicate what they're thinking, what they're feeling, and what their fears are for the future. But interestingly, out of all of these frustrations, the number one frustration for our patients appears to be this cognitive change, which is exactly what Dr. Parsons and Amy touched upon this morning. Not being as efficient as they once were prior to diagnosis appears to be the number one leading agitation for our patients. And it's interesting because agitation, irritability, frustration can come out in many different ways. So some of our patients discussed it coming out externally. So they will be, they have a short fuse. They will be verbally short or snap at their loved ones. Some even talked about some physical external presentation. So for example, their phone. I don't know if you guys can see my phone, but they're trying to figure out their password. And they get so frustrated and so mad that they can't get into their phone that they will slam it on the ground and then it breaks. And then a whole bunch of other things, repercussions ensue. So irritability comes out in many different ways, but it also happens internally. We see a lot of our patients start to talk down upon themselves, have negative self-talk. And as you see in the quote I just showed, it talked about the patient, you know, as she was getting frustrated with not coming up with the right word, she began to start thinking of herself as stupid. Depression is quite common in our patients. So depression is the overwhelming sadness, the feeling of lower self-worth, decreased motivation in day-to-day lives or things that used to bring you joy. Our 48-year-old individual, female with an astrocytoma diagnosis said to me, I lost my independence. I lost my will to finish school. And at one point, I lost my will to even live. I just didn't care anymore. I lost my friends and my daughter had to move in and I'm no longer independent. I have to rely on somebody to do just about everything. Nearly all of our patients report some symptom of depression. And actually, the research shows us that clinical diagnoses after a brain tumor diagnosis are higher than the general population and even higher than other cancer populations. Now, depression can present many different ways. I actually have a lot of people that come into me and say, I'm definitely not depressed. But when I start going over the symptoms, they check more of the boxes than they think. So psychological, you know, you can have sadness or that decreased joy, the tearfulness. You can also have behavioral symptoms of depression. So socially isolating from others, sleeping more, eating less. And then there's, as we spoke before, the cognitive component. So the negative self-talk, the feeling of low self-esteem, of worthlessness, beginning to have more patterns of talking bad to yourself or negative to yourself than positive. Depression is actually associated with a lot of impairment. So it is associated with day-to-day impairment. It is associated with cognitive dysfunction. A lot of our patients who experience depression tell us that they process information slower, that they are more distracted than they used to be, and that they can't store that information, that they feel like their memory has declined. And this obviously impacts your functioning around your home, but of course it impacts your relationships. It impacts your ability to go to school, manage work, and it significantly reduces quality of life. An interesting fact is that depression is the single highest predictor of decreased quality of life in brain tumor patients over and above tumor grade or treatments, which I just find to be so impactful that this is an area we need to be focusing our attention on. It has also been shown in a few studies to reduce survival. And as a patient's quality of life reduces, so do their survival rates. And so again, enforcing our need to be supporting this. There's also an indication that depression is more common in patients with left hemisphere tumors. So if you will remember from Dr. Person's talk this morning, the left is the language center. And we know that just what I'm doing now, communication is kind of the basis of most relationships. And so if you have reduced communication or frustration around not being able to communicate, it's the potential that that leads to a higher incidence of depression in our patients. The next thing our individuals in our focus groups talked about was this generalized anxiety. So this is more specific to like overall fears and worries. Just feeling like the next day or the next moment, the shoe is going to drop. Something bad is going to happen, and worrying and stressing over general issues in life. A 27-year-old female in our focus groups who was diagnosed with glioblastoma said to me, "For me, I've been struggling with anxiety. It's just those ruminating thoughts in your head over and over and over again." The literature shows us that actually about a fourth to a third of our patients report moderate to severe levels of generalized anxiety. And there's actually some risk factors that have been identified. Lower tumor grade. So I think that usually speaks to the longer time that somebody believes they're going to be living with this brain tumor. Females tend to report higher levels of anxiety, and also younger individuals who haven't yet experienced those milestones, maybe just got into a career, ready to propose to their girlfriend, are wanting to build up their profession or start a family. And we also see that location plays a role. So those with anxiety tend to have a tumor more located in the right side of the brain. And this isn't just with brain tumors. This is actually seen across a lot of other medical brain-based, like neurologic conditions. We see this in traumatic brain injuries that are on the right side. And we also see this in stroke patients who have had a stroke on the right side, that their levels of anxiety tend to be higher. So it's looked at as a little bit of a risk factor. What's interesting about this anxiety is our patients explain to us that while there's always kind of this low level of worry, the symptoms tend to be transient. So kind of that roller coaster. There's highs and lows with specific heightened times associated around MRI days. And this is a term that is not going to be new to the audience members, but that scanxiety that our patients describe to us. So scanxiety in the professional world is termed fear of cancer recurrence or fear of tumor progression. Those terms recurrence and progression are interchanged. A 39-year-old female who was diagnosed with oligodendroglioma told us during one of our groups, "At first I was frightened. Anytime I got this little headache, I was like, oh my gosh, it's back, it's back." So scanxiety, fear of cancer recurrence, is actually very common in all oncology populations. It has been noted as being one of the greatest unmet needs that is not being treated in our cancer patients. And when we investigated it in our patients here at VCU, we showed that almost all of our patients reported some kind of symptom and experience of fear of cancer recurrence. Now, because this is a very common and shared experience, a mild level is actually looked at as normal, right? Of course, somebody is going to be fearful if they're told this cancer is going to come back and they have to go through routine scans. And through time, if it stays mild, we see that it lessens. through time, this fear of the cancer coming back. But for those individuals that have moderate to severe levels, which is usually about 30 to 40% in our brain tumor patients, it can cause significant distress. In some, it can cause avoidance patterns where they stop going and getting medical checkups, stop their medication because they're scared to know what the results are. On the flip side, it can cause hypervigilance patterns. So an example of that, let me define that term. That is a excessive worry and checking. So in like a breast cancer patient, a physician could tell the survivor, go ahead and give yourself an exam, a self-exam once a month. We'll do an annual scan, a mammogram to check that everything's okay. And this patient would instead be checking 10 times a day, 100 times a day to make sure that they weren't feeling any lumps. An experience of hypervigilance in our brain tumor patients would be pollen season, and they have a little bit of a headache, and all of a sudden their mind jumps to the tumor is back and they're calling, asking repeatedly for an updated scan. Or a aura, a feeling that maybe they've experienced a little bit before, and they jump on the internet because they are determined that the brain tumor is back, and they spend 5 hours reading through Google documents or blogs about other people's experiences, trying to associate what they've experienced to somebody else's tumor coming back. And these experiences, we know, stop a person from living meaningfully in the day-to-day, and they also prohibit a patient from being able to plan for their future. This is what I hear from my patients. I'm not going to do that or plan that until my next scan. And then they feel like they have a little window of time to go and experience, but they will hold off on making future plans until that next scan. And why do patients do that? There is this fear of that shortened time span that Archie talked about. And in the field, we call that death distress. So a 39-year-old male who had an oligodendroglioma diagnosis said to me, the thing that worries me the most is how long can I stick around to help raise my kids? What are those milestones that I'm going to miss out on? Or, you know, maybe I don't get to see everything. So this is not uncommon in patients who have been diagnosed with cancer. About 32% of our patients talk about this fear of a shortened time span, this fear of dying, and what does that look like in their life? But we actually have identified that it's higher in those with brain cancer. Concerns that our patients talk about are that double awareness that Archie and I described before. This, how do I live my life purposefully and meaningfully while knowing that I'm living and thriving right now with an incurable disease? What are the missed milestones that I won't experience? Am I going to be able to see my child graduate? Am I going to be able to hit that retirement milestone that I've worked my entire life for? Will I be able to hold my first grandchild? And also this idea of legacy. There's this overwhelming sense of I need to leave a lasting impression on those that I love. And how do I do that? How do I do that meaningfully? How do I do that in the time that I have and this time clock that has started? Those that have high levels of distress in this domain do have a preoccupation with it. They have decreased quality of life. They have poor health outcomes. And some of them even go as far as I talked before, becoming medically non-adherent. And so they avoid topics or conversations with people, with their physicians, so that they don't have to manage that distress. So they basically avoid. It's interesting, they talk about in the literature this idea of a dynamic trajectory, which basically means that there are highs and lows in this. It is higher at initial diagnosis, and as a person comes closer to the time of death, and this is across other oncology populations and other disease groups, that this death distress reduces. We actually don't know if that's the case yet for our patients with brain tumors. It's something we still need to investigate of when this is heightened the most and where we need to start intervening. And I cannot have this presentation without talking about the overwhelming sense of resilience that was weaved through every discussion of the aforementioned emotional distress buckets that I just previously described. One of our patients, a 39-year-old male with an astrocytoma, said, "It's not going to be normal again." And I'm fine with that. Honestly, at this point, I embrace it. This is who I am, and I'm okay. I'm okay with this. I'm okay that this is part of my story. And I had to put 2 quotes in here because it's just so powerful. A 27-year-old female who is living with glioblastoma said, "Well, how do you define hope? It's important to think positively and hope for the best despite the odds. It would be hard getting through each day if we didn't think that way." So when I brought my patients in, the whole point was to talk about actually the distressing parts of their day. This was one of the largest themes, or not their day, their trajectory, excuse me. This was one of the largest themes that shone through. Patients talked about needing to live day to day and starting to integrate present moment awareness, which I think Alvina is going to speak a little bit about in the next presentation. But while they talked about the need to plan for the future, they talked about the need to understand, have knowledge of the disease and what the course might be. They talked about not letting that define who they were as a person and define their day-to-day life. So being present in the moment, making all the memories that they could and living purposefully in today. And then when they're graced with tomorrow, doing the same thing. So not allowing themselves to live too much in the future because that's when their distress would exacerbate. A lot of our patients also talked about a heightened spirituality, not only an internal spirituality, but also reaching out to religious groups or meditations, programs, a lot of different ways that people became more grounded in who they were as a person, what they believed the purpose of this life was, and how to make an impact upon that. And they talked about messages of acceptance, which is interesting because when I first think about acceptance, I think they're okay with this disease. And that's not what I mean by messages of acceptance. It's not that they have said, "Oh, it's a good thing I have a brain tumor." The acceptance is, I am aware that I am living with a brain tumor. I am going to try to thrive through this. And I'm accepting that this is a part of my story and my journey. And I'm going to do everything I can to make it the best that it can be. So it is an acceptance of it being interwoven in to the chapters of their life rather than defining them or taking over their life. And of course, the underlying theme in all of this was hope. Our patients talked about hope for strength. They, in these groups, talked about hope for one another. And then obviously, as we all are, hoping for an eventual cure to this disease. And I would be remiss, even though we have an entire presentation coming up in probably about an hour, or a little less than an hour, about caregiver mental health. So one of our patients, a 39-year-old female who had been diagnosed with oligodendroglioma, said, "I just feel so guilty because we had just barely gotten married. And I was like, if I had known about this brain tumor, I would never have done this to you, burdening you and saddling you down with this crappiness is what I mean." And that kind of resonates a little bit in what Archie was telling us before about, I want to propose, I love this girl, but what does that mean for her future and for my future? And being scared and timid about that. So the roles and the increased responsibilities that come along with being a loved one, a caregiver, a care partner, a care thriver is astronomical. I will just say that. They are countless. The caregiver is in charge of monitoring the illness, communicating with all of the medical team, arranging the hundreds of appointments that will follow that diagnosis, providing physical support sometimes, always providing emotional support, and also providing social support to others. It's not just caring for the patient or walking alongside the journey with the patient, but it's all the people that love the patient. And the care thriver, the care partner, caregiver is really the person in the middle and having to communicate back and forth so that the patient isn't inundated with everybody else's emotional reaction to this diagnosis or questions. And then obviously the ongoing decision-making that falls upon the care partner. There's no formal training for caregivers. We don't have a program yet. There are packets, there are booklets, there are mentors, but as far as I'm aware, there's no formal training program yet designed to when a patient is diagnosed with a brain tumor, or let's say a family or a couple is diagnosed, that the care partner is taken aside and said, this is what you're going to need to do. Here are the strategies and resources and tools. We know, and we're going to hear from Dr. Sherwood later, that caregivers experience a reduced quality of life. And all of our research to date at our lab has shown that caregivers actually have higher levels of psychological and emotional distress than the patients themselves. So in sum, I want to wrap up with the knowledge and the advocacy that mental health is health, and that mental health is actually a significant concern for our patients with brain tumors and their loved ones. And this emotional journey that I talk about is not a linear. You start here and you go through the stages until you're fine and you hit resilience. It is cyclic. It is like that roller coaster. There are high moments. There are low days. There are loop-de-loops that you feel all of it within a 1 hour time period. And each person's journey is personal. And each time course appears to be different. So we really need to individualize these programs. We need to shout to the world that quality of survival matters to our patients as much as quantity of survival. If we are going to find a cure for this disease, while we do it, we need to ensure that our patients have the best quality of life and quality of survival as they can. And as a provider, and all of the medical providers and clinicians on this call, we need to ensure that the resources are applicable to our brain tumor patients. We can't just assume something that works with other oncology populations works with ours. The brain, as we know, is the center of everything, and we need to ensure that we are tweaking things to the experience and the impact of tumors on our patients. And we also need to ensure that these resources, these interventions are accessible to all brain tumor patients and their loved ones. One day, a neuropsychological evaluation needs to be accessible to all brain tumor patients. Interventions for speech and language therapy, for memory, for depression, for fear of cancer recurrence need to be not only in our large academic medical centers, but they also need to be provided in our community hospitals as well. And that is the end of my talk. Here's my disclosure. And then obviously I want to thank everybody for listening. Thank you for giving us this platform to be able to talk about these quality survival topics. My lab has done amazing work, and I can't thank the members of them enough, and my funding resources to providing me the ability to talk with our patients and learn more. And then, as Amy said, I am open to whoever wants to contact me, either by email, you can see my email up there, and also by Twitter. Thank you.
Thank you so much, Dr. Logan, and thank you, Archie, both of you, for sharing the emotional journey of a brain tumor diagnosis. And Sarah, we look forward to hearing more from your perspective as Archie's partner and his caregiver. We are just going to go right into our next session, all about resiliency, which Dr. Logan kind of set up so nicely. So without further ado, Ashley, I'm going to hand it back to you to introduce our next presenter.
Wonderful. Thank you so much, Emily. Here's the question at hand. Is it possible to bounce back from the trauma of a brain tumor diagnosis? In this next session titled Bouncing Back, Becoming Resilient While Living with a Brain Tumor, or as Archie said, thriving with a brain tumor. Attendees will learn how to become resilient, recover from distress, and lessen these cognitive and emotional effects that we have talked about all morning. And how do we implement tools to manage uncertainty and take back control of our lives? Our speaker, Alvina Okwei, is a psychosocial behavioral specialist in the neuro-oncology branch at the National Cancer Institute at NIH. She has worked in patient outcomes research for over 12 years and is a licensed therapist, with her interests focusing on psychological distress and ways to treat the individual holistically by managing their care, helping them cope with the challenges that are often faced during this diagnosis. I have personally trained with Alvina in psychotherapy techniques to help our patients manage distress. She is a true gift to this field, and I could not be more excited to learn from her alongside everyone else on how we can become more resilient through this disease. Please welcome Alvina Okwei.
Thank you, Dr. Logan, for that introduction. All right, so yes, I will be discussing today really becoming resilient while living with a brain tumor. I have no disclosures. And so just the learning objectives, hopefully some things that you get out of this presentation. So learning about just the importance of resilience, learning about the different components needed to build resilience in your life, and just some coping strategies and techniques to take control and adapt throughout this process. So in discussing cancer and resilience, studies have shown that resilience can be learned, and having resilience during your cancer journey can lead to a better adjustment to your diagnosis, improving quality of life, mental health, and treatment outcomes. Additionally, we must be realistic that resilience can change over time. Life circumstances, your environment, and contextual factors that include illness-related areas such as disease uncertainty, individual factors such as how you and your loved one may cope with things, family-related factors such as the support you're getting or not getting, and lastly, social-related factors which can include the interpersonal relationships, the interactions you have with others. All of these can play a role in how you feel resilient and motivated to push forward. Also, when we talk about traumatic experiences, which being diagnosed with a brain tumor can fall under, I would be remiss if I didn't mention post-traumatic growth and how utilizing resilience as a coping tool in brain tumor patients can contribute to post-traumatic growth, which is a positive life change that can result from an overwhelming situation. So that can include having a deeper appreciation for life or stronger relationships with those close to you. So how do we define resilience? It is the ability to maintain or restore relatively stable psychological and physical functioning when confronted with life events and adversity. When thinking about this with a cancer diagnosis, how do you restore physical and psychological functioning the best way that you can as a patient? As I was preparing for this presentation, I noticed a few common words associated with resilience that I thought were important to share. Recovery. What does recovery look like now for you? Adapting. What are the new adjustments that you need to make life a little bit easier for you to handle? Personal growth. Are you discovering growth in areas you may not have imagined? Needing to rebalance what's important. And this last one caught my attention, bouncing forward. Recognizing that resilience doesn't mean that you're coming back to the person you were before your diagnosis. There have been changes, and it's how you focus on moving forward, finding meaning in your life after being on this journey. Now let's get into building resilience, focusing on areas that can be prioritized as you are on this journey. So the listed factors are all important to how you improve resilience after a brain tumor diagnosis. Active coping skills focus on how you implement healthy coping tools. Optimism is how you identify things that add happiness to your life. Social support touches on how to prioritize what you need from others. Your attention to physical well-being will focus on how you take care of your body. Your personal moral compass is about what's important to you, what you value. And lastly, cognitive flexibility is being able to look at a situation from more than one perspective. And first, let's start with active coping skills. When you actively use these in situations, you take control of what you can. You can choose how you can manage a situation like your diagnosis instead of choosing to ignore or dismiss things. It's giving attention to proper ways to address issues that may arise. Here are 2 coping styles for your resiliency toolbox or coping toolbox. So problem focus and emotion focus. Problem focus allows you to create solutions to problems that arise. When something happens, ask yourself, is there a way to solve this problem? If not, you may need to move into emotion focus, which is finding helpful ways to manage how you feel in situations that are out of your control. One type of coping I didn't add here is avoidance coping, trying not to think about something that's happened. And the longer you continue to dismiss or deny something, the longer it takes for you to adapt and deal with that situation effectively. So starting with problem-focused coping, when could you apply this type of coping? Do you need to create a plan on how you deal with a stressful situation? Maybe you need to call on reinforcements if you can't handle all the tasks that you have to do, or you're trying to establish healthy boundaries so that you can feel heard in situations. This could be the start of a nice little relationship between you and problem-focused coping. So let's look at a few situations that I've heard from patients that made me feel like this coping style would be appropriate to create a plan. So if you're not receiving appropriate communication about your appointments and scheduling of additional things, you may even start noticing that you're experiencing symptoms in between appointments and don't know what to do. Also feeling anxious and some fears about the future and wanting to talk to someone. With all of these, start with the first step that you can take. And if that means managing how you feel first before creating a plan, the next slide will help with that. So the SSTA method is a technique that can be used for problem-focused coping by first addressing factors that can get in the way of thinking clearly. To start, you must stop. Doing this helps with stopping yourself in the moment before doing something impulsively. When you stop, it helps you recognize how you react in overwhelming situations. It allows you to pay attention to how you feel. Here, you can also identify common thinking patterns you may have, or even how stressful situations make you feel. Physically, are you someone that gets hot? Do you tense up in certain areas? Lastly, stopping allows you to identify what situations, people, sounds may trigger you, just so you know what things to avoid or create a plan for in the future to handle how you allow it to impact you. With the stop step, it may be good to write responses to some of the things I asked, so you are aware of what things to be aware of in the future to know when you need to take a step back. Next, we move into slowing down. Think about the last time you were trying to deal with a situation and was this step missing? To be able to have mental clarity to figure out your next steps, you need to give your body and brain a chance to come down from a heightened state. Constantly being in a heightened state impacts how your body knows when it's time to relax and recover from a stressful situation. And so creating ways just to slow down is helpful. To the right, you'll see some helpful techniques that can help you to get balanced or feel relaxed. Deep breathing from the lower part of your abdomen. Progressive muscle relaxation focuses on tensing and releasing different body parts, or trying a fake smile in the moment. Resources with more details and links on some of these techniques will be shared with you after this meeting. So once you've gotten to a place where you've given attention to your needs, you can now think through a plan. So you can move into think. Start by defining your problem and identifying the goal you're trying to accomplish here. Then move into listing out possible solutions and then solve this problem. And to solve this problem, decide on the best solution. You may have to do a pros and cons list. And then lastly, implement your solution by putting it into action. All right, so now let's move into emotion-focused coping. And when could you apply this type of coping? When you're needing to work through a painful emotion, when a situation is out of your control. It could be used when you need a temporary distraction to take your mind off of something. The goal here shouldn't be that how you're feeling is going to just disappear. The goal is getting the intensity of the emotion to come down. So instead of a 10, you're moving down to an 8 or 7. So listed are a few situations where emotion focus can be applied when you're just having a bad day, feeling anxiety about your scans coming up, getting angry unexpectedly and not knowing what caused it. To use your emotion focus skills, here are a few things you can add to your toolbox. So start with prioritizing how you take care of yourself. The time and energy you give to others, make sure you're giving some of that to yourself as well, even if you're just starting with a small amount of time. Create ways to keep yourself grounded, doing something to stay in the present moment. Soothe your senses by utilizing the senses that are showing up for you in the moment. Use sight to take a walk outside and look at nature. Listen to a playlist you create to help improve your mood. Eat a snack or meal. For touch, give someone a hug or just sit next to them. And for scent, what are things you like to smell and how do you incorporate them in your home or even when you're away? Next, you can try engaging in a hobby. What are some things you're interested in? And if you don't have any hobbies, what is something you enjoy that can be transformed into a hobby? Exercise is another healthy emotion-focused skill that can boost your mood. Be cognizant of the intensity of any exercise you participate in and make sure you're mindful of what your body can handle. So you can also try focusing on a task that can help take your mind off of things. Some people really love cleaning, and if that applies to you, finding an area of the house to give some attention to. You could read a book that doesn't require a lot of effort, take care of your plants, which is a personal favorite, or just focus on something that needs your love and attention. Relaxation strategies are another helpful tool here. What items can help you? Use apps like Calm or Headspace. Even doing breath work is helpful too. Square breathing is one example where you imagine walking along the square, inhaling and exhaling at each turn. Lastly, practice, mindfulness, the ability to be present. Get a notebook and list out things you're grateful for or what things brought a smile to your face at the end of the day or week, just as a practice to recognize positive moments regardless of how small. And if you recognize you keep repeating the same things, start to look for different things that happen throughout your day. If you have a happy place, start to picture it when needed. Think about how you feel and incorporate your senses to really feel like you're there. You can also look at pictures that remind you of people, places, and things that bring you joy. And then yoga meditation can help with being in tune with your body, because that's important, how you give attention to what your body may need when feeling overwhelmed. So let's move into optimism as the next area to build resilience. Research on optimism has shown that it can increase your motivation, lower your stress, improve health outcomes, and mental health. So Martin Seligman, a psychologist who had an interest in positive emotions, described 3 kinds of happiness that I'll go over and see how it can be applied to your life. So the pleasant life is, the ability to amplify positive emotions and acquire certain skills to be able to do this. What activities lead to positive emotions for you, and how do you do more of those things? It's important to be aware of when positive emotions aren't showing up in an activity that once elicited those emotions, and try to incorporate other things just so you're continuing to see some joy in certain areas of your life. With this experience, capitalize on the moment. Show it through facial expressions or movement in your body. Tell it by communicating to someone that you feel happy, you feel better than yesterday. Share it through social media by sharing a message or a picture. The next kind of happiness is the good or engaged life. This is where you start to discover your strengths and reshape your life to make the most out of important areas in your life. What is something that requires a certain skill from you and also challenges you a bit? Doing things in this phase of happiness is what keeps you motivated. Identify what your strengths are and how you can utilize them. Are you someone that's dedicated, caring, and great at communication, how can you use that strength in an area of your life to keep you engaged? Last is the meaningful life, utilizing the strengths from the previous area that you identified and really serving something you believe is larger than yourself. That can start with finding a sense of belonging, connecting with a community of other patients. You can also see what gives you purpose. Are there areas that, give you a sense of accomplishment? Dropping your kids off at school, getting through a semester with good grades, and how do you lean more towards those things? Last thing is storytelling, which can play a role in finding meaning. How do you tell your story? There will be variations in your story from what things look like when you were first diagnosed to really how things have changed. What are you learning about yourself? Right now, with how you tell your story, it's really important. Your experience is important, and don't let anyone take that away from you. So with building optimism and learning what things are needed, make sure you also manage the 3 Ps. These can be automatic negative thoughts that you have in situations that can exacerbate mood symptoms. So personalization is thinking that you or someone is to blame for a situation that involves many different factors. Thinking that not having your health where it needs to be is all your fault, and not thinking about what other factors could be contributing, such as treatment or illness-related symptoms. Another P is pervasiveness. Thinking an event will impact all areas of your life. So going back to the health example, thinking that now you won't be able to do anything because you've been diagnosed with a brain tumor. And that truly puts you in a box where you limit yourself to what you can do. Lastly is permanence. When you view a negative situation as fleeting or lasting and unchangeable. Here it's knowing that certain feelings won't last forever. Over time, that feeling may be less intense. And so to manage these thoughts, challenge them with a few suggestions on the right. You start by asking yourself, what evidence do you have for thinking this thought? Collect the facts before already coming to a conclusion in your head. Also, think of looking at the situation from a different perspective to see if you still have the same thoughts. Another option is thinking of what you may need to let go of to move past this thought. And the last question you can ask yourself, what is something I can move towards in this moment to unhook from an automatic negative thought by moving towards a task or a person that needs attention, or just moving towards the person you would like to be in these types of situations to show that you can handle it. That may mean using relaxation techniques more often, talking to someone that can help shift your focus, or adding more positive self-talk when dealing with a distressing thought. So now let's talk about social support. Having people around you that are uplifting, that can help with certain tasks, can be a great benefit in your journey. Knowing you have someone in your corner, or just having that person that understands, what you're going through. Emotional support is where you feel love from others. You want someone you can trust when you really need someone to hear how this process is impacting you. But also this person, can really be someone that helps take your mind off of things outside of your cancer journey. Emotional support has the highest impact on quality of life and how you perceive stress. Who are the people that can fit here, who will listen or can help you manage your feelings when overwhelmed? Next, we move into informational support. Who are the people that give you the advice and information you may need to feel in control over the decisions you make? Also, the ABTA Care Line can be helpful since they can assist with educational and supportive resources. Instrumental support is receiving tangible assistance. Who can help with specific needs like watch your kids, or can step in and take notes for you during appointments? The types of social support provided can be specific ways to categorize people in your life to assist you in ways you need to. If you don't feel you have support in some of these areas, focus on ways to get that help, even if it's not from those close to you, but from individuals or organizations that may provide these services. Excuse me. All right, so getting support can be hard to accept, sometimes especially if you're used to being independent. Excuse me, sorry about that. However, it's recognizing when you need it. and being mindful of how you think about the help you get. So you could start with smaller tasks, focusing on the goal of what this will help you with. Start by checking in with yourself to see what type of support you may need, be assertive about what you want, and then express your gratitude for this help. You can also see if there are ways you can provide support, starting with just checking in with the person you see. Another way to get support is by connecting with others, trying one-on-one support through the ABTA or support groups you feel you're comfortable in joining. So another resiliency boost is prioritizing your physical health. How you take care of your body, starting with nutrition, eating a balanced diet. If your weeks get busy, how can you prepare by making meals in bulk and keeping a healthy snack stocked up? Sleep is also important for your physical and mental health. You can try a guided meditation if you experience disruptions in your sleep due to any physical symptoms or just constant worry. Next is your physical activity. Try to make it more enjoyable. Create a challenge with a friend. Change up what you do at times so you have some variety. And don't forget to recognize what accomplishments you do get during these times and reward your progress. Lastly, if you need to manage your symptoms, the My Story app that was created by Dr. Terry Armstrong in the neuro-oncology branch at the NCI and her team can help with tracking symptoms and provide self-care strategies. This app can be used by patients and caregivers. So now let's move into your personal moral compass in building resilience as you deal with the diagnosis of a brain tumor, focusing on how you think, your behaviors and what matters. With your thoughts, it's developing a set of core beliefs that are positive about oneself and one's world. And if you carry mostly negative beliefs, how you perceive your life and your abilities will be impacted. So to identify the core beliefs you have, start with I am, people are, the world is, and how would you fill in the blank with each one? We all have core beliefs that we build up from past experiences, and it's recognizing what yours are. I've added some positive core beliefs on the right here. And to get to those beliefs, identifying the negative ones that some people can attach themselves to, like, I can't ever be healthy or I'm not enough. Next, we will move into behavioral factors. Learn to engage in positive behaviors that align with your core beliefs. Take care of yourself, do things that bring on those positive emotions that I touched on earlier. And lastly is existential, focusing on religion and spirituality, something that can increase for anyone experiencing something traumatic. If this is an important area for you, what things help you find personal meaning and purpose and how you prioritize that. So last factor is cognitive flexibility. To be able to adapt in your journey to create resilience, focus on reframing your thoughts to look at things differently. We've touched on a few things in previous slides, and this helps you add more to your coping resiliency toolbox. The goal is reframing, and it's the technique used to really shift your mindset so you're able to look at a situation, person, or relationship from a slightly different perspective. It can help with how you view your illness or someone who has been diagnosed. Benefits of reframing include, helping change your point of view on how things impact you. Your emotions can be validated here, and it allows you to show yourself and others compassion. And here are some strategies to use to reframe how you think to manage how you feel. Write your thoughts down. Have a journal you use to work through your thoughts. Fact check those thoughts like I've mentioned in a previous slide. You can switch from asking yourself, is this true, to is this a helpful thought to have? Try to find meaning in this experience. Are you learning anything about yourself? Do you have a better idea of how you want to spend your time and energy with whom? And next, is there action that needs to be added? How do you create more of the experience you want moving forward? And lastly, when working with these strategies, know that it takes time. Give it a week before testing out other things. And then a few just additional coping tools for parents of children diagnosed with a brain tumor. A few just on support, taking care of yourself, keeping a journal, and also expressing ways that you feel, how you feel in a healthy way. Also prioritizing what is needed. with all of these, it's about learning these skills for yourself, but also the things that you can, share with your child going through this experience and how you can help them through this. And just to summarize, resilience can be learned and done at your pace. It's about how you move forward, adjust and adapt as things come your way, coping with a brain tumor diagnosis. Resilience can change, so be mindful of the situations that make you feel like you're taking a step back. Recognize that starting with the basics, like taking care of yourself, can be what gets you back on track, and that certain factors that promote resilience may be needed in certain moments, and recognize what you may need and take the necessary steps to get there. Thank you again. A few of the references. Thank you for tuning in, and let me know if you have any questions.
Yes, thank you so much, Alvina, for sharing with us the strategies and tools to become resilient. I would now like to welcome back our chair, Dr. Logan, as well as Archie and Sarah, as we transition into the Q&A portion of this session.
Great. Just as a reminder, if you do have questions that you'd like to ask any of our presenters, Archie or Sarah, please type and submit it using the Q&A button on the bottom of your screen, and we'll answer questions as time allows. So let's see, one of the first questions we have is asking about who do you share information about your diagnosis with? Are you expected to share it with people outside of your close family and very close friends? What is the norm? And maybe Archie, you can share some insight on who you chose to share your diagnosis with.
Yeah, I think it's a great question, because we have a tendency, I think, to get labeled once you tell somebody they have a brain tumor. I think a lot of people just don't know how to handle that, and they don't know what to say, what to kind of do. So a lot of my experience is kind to protect my own kind of psyche and my own emotions, and not, you can imagine getting the question of like, oh, how are you doing? And it's a very simple question, but it's a very complex question to answer all the time. And so I think talking to your family, the people that you trust, the people that you know you, and know kind of how you tick and how you work, I think that's the important stuff. I think, having to tell employers and things like that, it's a very nervy kind of experience too. Like, what's going to happen here? If you have a job, like maybe talking to HR about that experience too, and really just trying to find a safety net, and not going too far beyond that, because things will spread. Things naturally spread in this world, and you tell the people that are important to you, they might tell people that are important to them, and it comes full circle. So at the very beginning, I just kind of, like I said, I called Sarah, I called my mom, and those are the only people in my world at that time. I have a brother who I love very, very much, but it was just, who do I go for comfort, support? Those were my two first choices, and then the rest kind of disseminated from there.
Thank you, Archie, for sharing your insight there. You mentioned work and getting support at work. And that's one of the other questions that we have is, how do you bring up, I think Ashley and Alvina, you both talked about getting support and accommodations in the workspace, but how do you bring that up? Archie, did you work at all through your tumor diagnosis? And do you have any advice that you can share on finding that support in the workspace?
Absolutely. Yeah, I was actually at work when I found out. I mean, I went through an MRI at lunch break, and then was supposed to go back. I had clients, and I had things to be done at work at a law firm that doesn't particularly care about the one individual person in the law firm. It's a bigger whole and a bigger entity. So I had to really kind of take stock in that. Like, my cognitive ability was not great after surgery. I couldn't say certain words, that all of the things that people have presented on, that frustration, that kind of self-doubt. How was I going to perform? How was I going to do? And I I did take the opportunity, take a couple of days to just kind of sit with what was happening. And then I went in, I did talk to my supervisor. I did go to HR. And my goal in all of that was just to make sure that I had insurance protections and that I had job protection. And I didn't really go to colleagues at that point. I didn't really want to be, like I said, labeled as just the guy with a brain tumor. People sometimes tend to look at you in a different light. And I still wanted people to consider myself as a strong attorney and client-based person that I could do the job. So it's a interesting kind of emotional development, but I think it's important to share that, especially at work, but find that comfort. If you don't have that comfort relationship with your direct supervisor, that's what HR is there for, that to talk about those particular things and keep whatever level of secrecy or kind of information close to your vest if that's what you want. But I think it's important to share on those particular levels.
I would also just add to include anybody that you need to make a safety plan with. So as a caregiver, I told my boss, because if Archie texted me or called, I'm having a seizure or something like that, I had to tell somebody that I'm leaving right away. And they were the only people that needed to know why. And God forbid if anything happened at work, Archie needed to have somebody that he could say, this is happening, and leave right away. And that person would know what to do with the rest of your schedule. So it is important to make a safety plan and have like one person that you tell that knows, so you can exit.
Thank you for adding that piece, Sarah. I think that's so important and something that we often overlook or don't think about. Ashley, did you want to add something?
I was just going to add that I think the original question was like, is that common, right? Is it common to share with everyone? Is it common to keep? And I don't think there is an answer for, is that common? I think it's personal. I think everybody processes this diagnosis differently. I think everybody has a different way of reacting and holding that diagnosis. But I agree with Archie and Sarah on finding your immediate support system and leaning on them the most is important. And I really love what Sarah said right there, which was you both need to find those support systems. It's not just advocating for the thriver and the patient, but it's also, advocating for the care partner as well.
Thank you so much for sharing that. Let's see, another question we have is about the fear of reoccurrence. Ashley, I think you were the one who brought up how that's one of the greatest unmet needs. What support is available to help address that need, and how can patients and families find that support?
That's a great question. And I will let Alvina jump in also on this after I talk about it. Currently for brain tumor patients, there is not a lot available right now. And I say that because there are a few interventions out there that have shown to be very successful in reducing fear of cancer recurrence in oncology patients. Unfortunately, most of these interventions have excluded brain tumor patients. And we find this in the field, that there is this misnomer that patients with brain tumors are not cognitively capable of interacting with these interventions, learning these interventions, and applying them into their life. And there's a lot of muddy water when somebody has some cognitive impairment. So for science, it's easier just to exclude. I think Alvina and I both take the stance of we will not allow that to happen anymore. We are creating interventions, implementing interventions. So currently at VCU, we actually just received funding to take the fear of cancer recurrent interventions that are designed with other cancers and adapt them to our patients. So that hopefully will be coming out within the next year, but I'm gonna put it over to Alvina because she can talk about the in the moment, that's anxiety. What can you do to help manage it when you don't have an intervention that you've gone through to help for future fear of cancer recurrence?
No, I think that's a really, it is a, something to speak on, just because, like Ashley mentioned, there really isn't those resources out there. But it really is, understanding like, what are the things that do work for you in moments, especially when you get like overwhelmed. Cause it's like, yes, like this is something that I can't control what happens with the scans, correct? And so it's knowing like that uncertainty, those feelings, those, overwhelming feelings, like that's going to happen, but when I think for you, it's not losing sight of like, yeah, what things do work for you. I know here within our outcomes section at NIH, we have interventions like a VR intervention. And so patients are able to use a VR headset before they can, go on the, before they do scans. And so that's been something that we're testing out. We're also doing kind of talk therapy. And one of the things that's been important for us is trying to get patients out of transition phase, so recurrence, just because that can be a stage where you want to kind of talk through a lot more things of, symptom management, or how that relationship is with your, healthcare providers, or maybe talking about the relationships that you're having with others. The conversations even can focus on future and mortality, and just kind of really talking through that. But it really is providing a space for patients to kind of talk through, some of the challenges that they haven't been able to kind of talk to other people about. So, I think like, Ashley said, it's creating these interventions within, some of the organizations, institutions, to know that like, it can work in brain, it is feasible in brain tumor, patients. It's just doing more of it.
And I'll add one thing too, a patient perspective is kind of what you both just talked about, is creating that space for yourself. I know when I was going into MRIs and a lot of people knew I had brain cancer, and they knew I was going for MRIs monthly, and then, every 2 months. And then as we went on, lesser and lesser, but people wishing me well going into a brain tumor or going into an MRI is not really a helpful thing, because I can't do anything about it except for lay there and hope and hope and hope. So there's different ways to kind of protect yourself, if you will. Maybe not sharing the date of the MRI, but sharing the result of the MRI, so that you have some sort of control over your own life, your own social outlets. So I was getting more overwhelmed and anxious when I was receiving texts right before I was getting changed and getting my IV put in. And it's just, I really, really appreciate my supporters and my friends, my families and loved ones. But at that time, I had a single vision in my mind and a routine that I did for every single MRI, like any sort of athlete that goes through a warm up. That was me. I just wanted to make sure that I was not interrupted in my own process. And that's kind of a patient perspective I would put out there, is protect your own process, and don't feel the pressure of letting everybody else know until you're in a space where you allow yourself to be comfortable.
That's so important, Archie. Thank you so much for sharing that insight and that advice. I think, protecting yourself and setting those boundaries for yourself is really important. Another question that we have here is, and I think it's a really important one too, is what is the best way to encourage yourself to exercise or engage in some of those great practices that you shared, Elvina, when you're feeling deep in that depression, or you're just feeling down, having pain, feeling your side effects, fatigue? How do you get yourself moving? How do you get yourself to stay positive and do those exercises that you shared?
Yeah, no, that's a really good question. And I think one of the things is you got to start small, right? Because sometimes we have this thought of like, we have to do 30 minutes of exercise, or we have to do this. And it's like this thing, like I mentioned, of putting yourself in this box. And it's like, well, what can you do? All right, let's start with a minute, and then like, build up from there. And even if it doesn't look like how you used to do things, it's like kind of giving yourself some grace and compassion of like, this is where I'm at now. And so what can I start with? So I think that's one of the things that is also, being able to recognize the self-talk that you have too, correct? of like, understanding if I'm trying to, motivate myself to do something, what are those words that I'm telling myself, or the statements that I'm telling myself? Because that also needs some attention. If you're constantly bringing in that negative self-talk, recognizing like, hey, it may need to be shifted just a little bit. But yes, I think starting out with just, starting small and knowing like, this is a goal that maybe you start with small steps and then you build up from there.
I have an example that I tell my patients when they ask me this question, because it's a very common question. I think Alvina and I get it quite frequently, is if I decided a goal of mine was to run a marathon, I'm not going out tomorrow and running a marathon, right? I'm going to be training and working towards that marathon over the next 6 to 12 months. So I tell my patients, do it the exact same way. They have a program of the couch to the 5K, which means the first step is you get off of the couch. And then the next day you get to the kitchen. And when you finally make it to the road, you go each day to the next mailbox. You don't add on more than you can, you don't bite off more than you can chew. And you definitely don't go from being in a hole to a joyous person wandering around dancing and singing and, rainbows and unicorns. So start small and make very small progress steps along the way.
Yeah, and for me, in order to prove that I could leave the hospital and go home, I had to walk around the surgery center and post-op center. And that felt like the biggest challenge of my life at that time, because I was not only proving to myself I could do it, but I was proving to everybody else that I could do it. And my freedom of that was to go home, and something I took for granted before. Then being a runner before this, my goal was to just get involved with not only challenging myself to get fit, but having a reason to do it and a goal to do it was by joining ABTA runs and other runs and creating my own. So I just a couple of weeks ago finished the New York City half marathon, and that was just part of the process. It's 10 years later. I've run half marathons before, but this one and all the runs that I've done for brain tumor groups it's so special to not only be able to do it, but be able to do it to provide hope for yourself and provide hope for others. So there's not only those instances of just getting off the couch is for yourself, there's other angles of getting off yourself or getting off the couch and helping yourself, but thinking of other people too. I think that's a really good motivator for a lot of us is, I didn't want to have to go through this. I don't want to see anybody else struggle with this. How can I help?
Thank you so much for sharing that, Archie, and congratulations on the half marathon. That's amazing.
It was no blazing speed, I promise that, but it was completed. So,
well, that is all the time that we have for questions for this session. I'm going to go ahead and turn it back to Emily.
Yes, thank you so much, Dr. Logan and Alvina and Archie and Sarah, for just sharing your insight and pearls of wisdom really for everybody listening here today. We do have a short break. We'll resume back in just a few minutes, and actually Sarah and Archie will be right back with us. Our next session is all about empowering the emotional well-being of the caregiver. So we'll be back in just a few minutes. Thank you all so much. All right, welcome back, everybody, for our very last session. I'm going to welcome back our chair, Dr. Logan, who will introduce the session, and our speaker. Thank you both so much.
A brain tumor diagnosis not only affects the patient, but the family members and loved ones who care for the patient as well. In this next session, titled Empowering the Emotional Well-Being of the Caregiver, attendees will explore the many roles of the caregiver, how to care for the caregiver, and strategies and resources to empower the caregiver to make informed decisions throughout the treatment and the care of their loved ones. Presenting on this very important topic is our speaker, Dr. Paula Sherwood, who is a nurse researcher and full professor at the School of Nursing, University of Pittsburgh. Dr. Sherwood has been conducting federally funded research in the area of neuro-oncology caregiving for over 15 years and is particularly interested in how providing care for someone with a primary brain tumor affects the care partner's emotional and physical health. While I had not personally met Dr. Sherwood prior to inviting her to present today, I have been a long-standing fan of her research and dedication to the field of neuro-oncology caregiving, a population often forgotten about. We need more advocates like Dr. Sherwood in our corner. Joining Dr. Sherwood is also Sarah, which we have met before, the wife of Archie, whom we had the pleasure of speaking with briefly, but we will talk to her longer now. Sarah is going to also share her personal experience as the #1 member of Archie's team. Please welcome Dr. Paula Sherwood and Sarah.
So we'd like to start out really hearing from Sarah because what I do is tell you things secondhand, and Sarah can really kind of tell you things right from the gut from having lived through this experience. And one question that I just kind of like to start out with is a really overall question that could take up 3 or 4 hours, but Sarah, you don't have to talk that long. The question is, what do you wish that you knew then that you know now? So in terms of helping other people out there in the audience, other caregivers, what do you wish you knew?
Many things. I would start off with saying yes to help. This is a long game. It's not just an acute period. So, which we should be thankful for, right? Look at it as a long game. There's periods that you need more support, but medical bills pile up. So if there's a, GoFundMe or whatever for the financial aspect, say yes. It's a little bit weird, but it's helpful. Meals are great. And you can give people your dietary restrictions and they can honor that. There's so many things that I wish I had said yes to. I find that the best thing to do for a caregiver is to take care of yourself, because if you're empty, so is your care. So when Archie was going through all the weeks of radiation and chemo, I got a massage every week. I felt really guilty doing it, but I made myself do it, and it was very helpful. I would say a support group. I went to a support group and it was really helpful. And I went to a specific brain tumor caregiver support group. If you go to other cancer support groups, you might get a little irritated like I did when people were upset about, cancers that in my mind don't really compare to this. So it's almost like, anyway, I would suggest going to a specific brain tumor caregiver support group. I went to a young person's, it was even more specified because we were so young. And I think oftentimes this hits people at an interesting age when maybe their life is just kind of getting going. I also would say, as Archie had mentioned, this is a new normal. And it's for both of you. So it's hard when the other presenter had mentioned that the person might be going through irritability and agitation and all of these things. And it's not your fault. None of this is your fault. And it's best to try and figure out a way to support each other with these really heavy emotions that you're going through, instead of kind of building resentments, because it's extremely easy when they're irritated for you to then feel bad and even try and overcompensate that. There's a lot of overcompensation, and your stress level is extremely important. I would say find somebody to talk to. specifically somebody that kind of focuses on oncology. There's a lot of therapists, but I think the people that are specific to oncology kind of, it's like they understand it more, because a lot of the times, even when I would speak to my friends at this age, everyone was like focused on their wedding and babies and everything. And I was like, I think Archie might die, and what are you supposed to do with that? We waited to get married until I cared about the colors of our wedding. And I really loved the colors of our wedding. So it's, it's important to prioritize yourself so you can prioritize them. Also, don't live your life like they're going to die. Live it like they're going to live. This has given us an opportunity to really get clarification on our life. Like, what are our priorities? So you can live your life together with a clearer mind of what you want to make this life about, and I would say move forward with that, because if you live it like you're dying, you're going to run out of money faster than you even know. So it's important to do that. But I think that's what I would say.
Did you find it hard to find people that were willing to help? Kind of how did you go about finding people that you could ask for help?
Yeah, it's hard because initially everyone wants to help, and initially you're in so much shock, you have no idea what to do. I thought of another thing that I had really wanted to say was, you don't have to tell you don't have to tell everybody everything at that exact time. Because everybody will lean on you for disseminating all of the information right away, and you don't have to. It's important to process it yourself first. Otherwise, a lot of information could kind of go all over and it could become even more dramatic. So in the beginning, everyone will offer support. You're not going to know what you need because you still can't believe this person has a brain tumor. And I would say I sometimes still can't believe that Archie has a brain tumor. It's still like shocking. I know that this is 10 years later, but sometimes I'm like, how am I speaking right now to you guys? This is what is this life? But it's this life that we're given. And I would say, if you have a person that you could go to, so my sister, and Archie's best friend, Joe, we sort of kind of leaned on a little bit to like help. I think they figured out like a financial GoFundMe thing. And then Archie's work did this great food thing. And at the time, none of it mattered. But after a couple months, it was really helpful to have some of those frozen meals in the fridge. And especially we were long distance, so I wasn't even with him all the time. So I think if the caregiver has somebody that they can also lean on, that's really helpful.
Okay. And one thing is, you mentioned a lot about the importance of taking care of yourself. Did you have any special tricks or things you told yourself to make sure that you did that?
Mm-hmm.
Because you also talk about the guilt of doing things for you when, all of this stuff is going on.
Yeah. I told myself, I think what I said in the beginning as well is that if you're empty, your care is empty. And I would say that to myself a lot. Like if I really do want to show up for Archie, which I think everybody here who's listening, you're really here because you want to show up for that person. This is our task at hand. And if you really want to do that, you really have to take care of yourself. There's not really an option. So even when you feel guilty laying in that massage table, you're thinking, okay, I'm getting filled up so I can fill him up. So I told myself that a lot, and I still work daily with feelings of guilt. Now there's mom guilt and caregiver guilt. It's like, holy cow. And sometimes I look at Dylan and I feel guilty, even just this having him. Sometimes it's like, did we make the wrong decision? But I know we didn't, but guilt is a very big piece to all of this. And it's a daily thing of working through.
I think that you put that beautifully. And I just want to say thank you very much. You know, when we asked you guys to come and share, we asked you questions about kind of the beginning of this, and that's not an easy place to go back to. And so I just want to say, you know, thank you for being willing to do that, and to share. I believe that right now I'll start with my presentation, and then depending on how Dylan's doing, then we'll either have both of you back or we'll have Sarah back for questions and answers. I do work for the University of Pittsburgh, and my research is funded mostly by the National Institutes of Health. So I am Paula Sherwood. I'm from the University of Pittsburgh, and thanks to the ABTA for giving me the opportunity to talk with you today. You know, I think Sarah did a beautiful job of talking about some of her coping strategies. My job is to do research to see how to help family members of people that have brain tumors. So that's my sole focus. And what I'd like to do this afternoon is share with you some of what they've shared with me. And a lot of the things that I say may be things that you already do, but I'm hoping that one or two things might click in and be helpful for you. So I want to start out with sharing Ryan's story. And before we do that, our objective today, we're going to focus on three main areas. We're going to focus on your emotional and physical health, how to navigate the healthcare system, and how to be an advocate. So this is Ryan. I met Ryan over 25 years ago, right after he was diagnosed with a glioblastoma. And I was working as a clinical nurse specialist with a group of neurosurgeons. And I ended up spending a lot of time and grew very close to Ryan. This is Ryan, and then you see Ryan with his mom, Tish. And one thing that came out for me was that his strength of spirit and his family's love really affected how I do my job. And I became unbelievably frustrated that I couldn't help them more, that they were going through all of this stuff. And there was really nothing I could do except for these things that I felt weren't enough. Ryan is the reason that I picked this area of research, and it is his legacy that I celebrate with you. So we're going to learn from the experts. We heard Sarah talk and give some of her views. What we do, the research team at the University of Pittsburgh, we talk to and carry out research studies with family caregivers. And we listen to what the caregivers have to say, and then we do our best to summarize that, get that out in the literature so that other people can read and learn from that. We take this responsibility very seriously because we've promised the families we work with that we will share their experiences with future caregivers for the express purpose of making their lives easier. So the first thing we're going to tackle is protecting your mental and physical health. And just as a kind of aside, remember we're focusing on the family member. And so in our world, we call that the caregiver. And a lot of people think of caregiver as doing kind of medical things or personal hygiene things. A caregiver is basically someone who supports you in any way that support takes form. So it could be emotional support, it could be financial support, it could be cognitive support, but we will refer to people that do that as caregivers. And caregivers describe a lot of health problems. But one of the most common things we hear is, I'm not the one with the brain tumor. It's my loved one's health that I'm worried about, not mine. The problem, as Sarah really just hit it right on the dot, is that if you're providing care and your health declines, you're not going to be able to provide the type of care that you want to. The other thing that will happen is that when that initial crisis is over, your health is going to be in a state where it may be beyond able to go back to what you were previously. So caregivers talk about their health problems by saying they feel exhausted, always tired, poor sleep, feeling depressed or worried, having general aches and pains and headaches. From research, we know that caregivers, and in particular neuro-oncology caregivers, have very high rates of depression and anxiety, and those are higher than rates in caregivers of any other type of cancer. The other thing research has shown us is that caregivers have altered immune function. You may not respond to vaccines as well as non-caregivers, which is particularly important right now with the pandemic. We know that caregivers get sick more often, and when they do, they stay sick longer. They have higher levels of blood pressure, higher glucose levels, sugar levels. So really, then it's taking a look at what causes this. Well, the main thing that causes this is that the depression and anxiety for neuro-oncology caregivers is a stress response. And like any stress response, it affects your body. And the way that I kind of conceptualize this best for myself is, let's say you're walking along the road and you run into a bear, and that's the bear picture that you have right there. Well, what's going to happen? Your body's going to immediately kick into fight or flight response. So your brain's going to sense that there's danger. It's going to tell your organs to start pumping out sugar so that your muscles can move fast, to pump out epinephrine to increase your heart rate, and it, just be prepared for the flight, or excuse me, prepared for the fight. Well, the problem is that when people go in and this happens to a caregiver and a patient, that fight or flight response kicks in. The main difficulty is with a bear, you either get away or you don't, but that stress response goes away and you kind of go back to normal. In neuro-oncology, that bear never leaves. So your body is constantly, going up and down with surges of adrenaline, surges of glucose. And over time, that affects your immune system and places you at incredible risk for poor health. And so that's kind of the way that I think of the stress response there. So we know that caregivers are more likely to put their own health care second to their loved ones, put PCP visits on hold. They may skip annual physicals or tests. And that really comes around to putting the patient's need above theirs. And some of the things that can contribute to that, demands of care. So during the diagnosis, the surgery, the treatment, caregivers are going to have to pick up things that the person with the brain tumor did before. And so your care demands are all of a sudden a lot higher. Things that you may have done before, like if you went jogging every day or did something like that, no longer you have time for, and really deprioritizing your own needs. So how can you manage your physical health? The first and probably most important part is taking care of your emotional health. And that may involve going to the primary care provider and saying, okay, this is what I'm going through. And some people go on antidepressants or anti-anxiety medications. Some people do therapy. Some people do support groups or find support from religious or spiritual leaders. But anyway, any step that you can do to take care of your emotional health is going to help your physical health. The next thing is eating a healthy diet. And, at this point, if you're going through the one of the crisis phases, it's a lot easier to run through the drive-through than to sit home and, cook this 5-course meal. Luckily now we have a choice in restaurants. So you can choose not only a healthier restaurant to do a drive-through, but you can also choose a healthier choice at that restaurant. So keeping some of those things in mind is good. Being physically active, and that really seems to be a theme throughout all of the talks today. And I would really echo what was said in the prior session. So most of us, when we say being physically active, you think, okay, so I have to do aerobics for an hour 3 times a week. Well, no, you don't, because you probably don't have time for that, especially with all the new stuff that you're taking on. Doing something 5 minutes a day is great. And that is, a great first step. If you can do 5 minutes a day, you're doing 2 things. Number one, you're doing physical activity. And number 2, you're prioritizing your own needs, which you absolutely have to do because pretty much nobody else is going to do it for you. So there are a million things on YouTube that can help you exercise. I would say if you have health problems or if you're concerned about exercise, talk to your PCP first. Certainly not all internet sites are good. For me, for example, when I get stressed, I do yoga. And so I go to YouTube and just type in beginning yoga and it pops up with a bunch of videos and you can play the video and kind of do it with them. You also want to try as much as you can to get adequate rest and sleep. And this is very difficult, especially for people who are sleeping in the same bed as the person with the brain tumor, because if their sleep is disrupted, then your sleep is going to be disrupted as well. So how can others help you manage your health? Really, one of the big things that you can do is let your PCP know what's going on. Your PCP should know that this is an incredibly stressful time, because if you walk into a situation, as has been said before, with already you have high blood pressure, maybe you have diabetes or chronic inflammation, something like that, those conditions are likely to worsen if you get stressed out. And your PCP needs to know this so that they can keep a closer eye on you. Making sure that you go to all of your checkups, that you don't put off the annual physical, that you get all the screenings that are recommended for you, and really finding an outlet for your stress. And this is partly where engaging family and friends can come in handy, because maybe they could go for a walk with you for 5 minutes, a day for 2 to 3 times a week. But they can help in making sure that you're taking care of yourself. So the take-home messages here, number 1, don't neglect your own health. Go to all your checkups. Take your medications as prescribed. Picking up scripts is another thing that kind of interrupts your day. But you can put those on automatic refill. A lot of places will even deliver them. And finding an outlet for your stress. So that's the taking care of yourself part. The second part we're going to talk about is navigating the healthcare system, which is also known as how do I become a medical expert overnight? So caregivers have been very vocal about some of the issues that they have with the healthcare system. Some quotes are, the doctor's time is so limited, it's hard to get in everything we want to talk about. I know I should be asking questions, but I don't really know what to ask. Some caregivers have said, as the caregiver, I wish I had some time with a doctor when my husband wasn't in the room, but I'm not really sure how to do that. Some people don't want to seem unintelligent or stupid by asking questions. And some people feel that they have to be cooperative to be a good patient, so they don't get labeled as difficult. Some things that cause problems in communication with healthcare. First of all, issues with healthcare providers. And we just mentioned some of the things that caregivers feel when they're communicating with their providers. When it comes to communication, people have very different styles. So you may be someone who wants a lot of details. I want a lot of facts. I want to know everything, all possible scenarios, all of that. And then you may be the type of person that says, okay, just give me the main bullet points, because that's really all I can handle right now. And that's kind of what I want. The trick to this is that your doctor also has a communication pattern. And if the way you communicate and the way he communicates or she communicates don't mesh, then you're kind of setting yourself up. So being open with your provider about how you communicate and how you would like people to communicate with you is very important. Some problems with the healthcare facility. The number one would probably be, I have 15 minutes. I have 15 minutes to sit there and find out if the tumor is coming back, if the chemo is working, if the radiation is working. All of these things I have to do, I have 15 minutes to do them in. And there was a time when you would go to the doctor and he'd sit down and spend half an hour to an hour talking to you and going through all these things. And that time went away a long time ago. And in our current healthcare system, we have constraints, and those are the constraints. And those can be very frustrated. They are heavy patient loads. Other problems that you can have with the healthcare facility is how to move within the system. How do you get referrals? How do you get second opinions? And that can make communication more difficult. So to help that, the first thing you can do is set the stage for good communication. And that really is being open and honest about, this is what I want when I come to these visits. And then learning how to work with your provider's communication style. Excuse me. And the second is knowing who's on your healthcare team. So in neuro-oncology in particular, there are about 8 or 9 different providers that you're going to see, from the ER doc, if you start there, to the neurosurgeon, the neuro-oncologist, the neuropsychologist, the neuroradiologist, the neuro-ophthalmologist. And there are just a whole bunch of people. And most caregivers find that it's easier to keep a book. In fact, I've met very few caregivers that don't keep some kind of a book or a binder. And in that binder, they include all of the different providers and what their area is. So, well, if this is, problem A, I need to call this person. And you can also put in there how they like to be contacted. Some people like to be emailed. Some people like to have a message left at the office. But knowing that is good. How to ask for help. And excuse me, I'm just going to take a quick drink. It's very important to come prepared. Write out your questions beforehand. And when you write out those questions, we'll talk a little bit about this in a minute, but write out the questions, bring them with you. If you can make a copy, make a copy. And when you check in, sometimes it's helpful to give that copy to the receptionist or whoever's checking you in. They can pass it along to the provider, and then the provider knows, okay, these are the things that I need to answer when I go in this room. Excuse me, and be specific as you can. We talked a little bit about your healthcare provider's communication style, but the other thing to mention here is that providers typically, in my experience, tend to do better when they have facts. So if you walk in and say, his headache's really been bothering him lately, that's one way to present what's going on at home. If you keep a symptom diary, and I think Alvina mentioned the symptom diaries that are available from NCI, or just writing it down in a notebook. If you walk in and say, okay, 2 weeks ago, my husband would rate his pain at a 2 or 3 out of a scale of 10, and it would happen 2 to 3 times a week. Now he's rating his headaches as an 8, and they're happening almost every day. You can see the difference in the way that those two things are discussed or brought up. And the more specific and detailed and fact-based you can be, the better, typically the better off that information will be received. And lastly here, I think that it's very important that we recognize that healthcare providers have a viewpoint about communication too. And there was a consumer report where they went around and asked doctors, what do you wish that your patients knew? And one of the first things is that most doctors don't feel like they have enough time with each patient. That 15 minutes or 20 minutes or half an hour block is really not enough to go into any depth. So that's frustrating for them too. Doctors also said, and this was with doctors, so that's why I'm saying doctors instead of providers, value courtesy and professionalism. They talk about they talk about being frustrated when people don't follow the suggestions or the care that they suggest. So, if that's the case, then saying, okay, well, we weren't able to do what you told us to do, but here's why. And then you can troubleshoot around that. The other thing that doctors typically said was that they have a lot of concerns about patients getting information online. And I would say that in neuro-oncology, that is an incredibly difficult thing to do. And I didn't cough all day long until I got on this call. So excuse me, I don't know what's wrong with me there, but getting information from the internet is an incredibly difficult and challenging thing, because especially in neuro-oncology, so many factors go into what you're going to experience that it really is not a reliable source of support. So take home messages for navigating the healthcare system. The first is be prepared, have your list of questions, and then take notes. So typically what will happen is you'll ask a question, they'll answer it. Well, these are high stakes appointments. These are not, appointments where you go to a health fair and get your blood pressure checked. These are times where you're finding out some significant things. You're going to have an emotional reaction to what they say. And that's going to kind of overtake things. What I suggest people do is some people audio tape their visits with the doctor so that they can go back and process everything. Now, please be aware that audio taping someone without their permission is illegal. So you need to get permission first. The other thing you can do is take lots of notes. And I think Sarah, someone had referred to this before. This is a really good job for a family member or a friend, because then all you have to do, you don't have to worry about taking the notes or writing everything down, getting everything complete. You have somebody else there who's taking the notes for you, and you can just concentrate on your questions. Making the best use of a limited time is deciding what questions are the most important, trying to stick to the main point of a question. So typically you ask something and the provider will say something back to you, and then that kind of leads to a question over here that wasn't on your original list. So if you try to stick to that, it usually helps. It is not uncommon for there not to be enough time to get all of your questions answered. And in that case, then ask if there's someone who can take a look at your questions and get back to you. So it could be the provider, it could be a nurse, it could be a physician's assistant, it could be a social worker, but make a plan as to how to get all of your questions answered. So the third area that we're going to hit is, how do I advocate for my loved one? The changes in the healthcare system pretty much require that anyone who goes into the hospital or goes into a treatment plan for anything really needs an advocate. Advocating with healthcare providers, we talked about, and I gave you some suggestions there. during the appointment, listening to what they say, having somebody else take notes for you is often very helpful. After the visit, keeping records, making your next appointment. And most people that I know will keep a binder and say, okay, this appointment is on this date and this is what we found out. And they keep, copies of maybe lab tests, of doctor's office summary notes and things like that. Another area that caregivers sometimes struggle in is advocating with employers. So caregivers say that some common work concerns are that their schedule hours are reduced or they're changed. They may be reassigned duties. They're worried about losing their job or forcing early retirement. If the caregiver is the person who is carrying health insurance for the family, then maintaining that employment becomes even more important. And you really don't know sometimes what programs are out there and available. So receiving the benefits you need, there are a lot of government programs that will pay for paid time off. And it depends on your company size and organization and kind of a whole bunch of other factors. But there are programs that will protect your employment. You can look into those yourself. You can ask the social worker. If you have a friend or family member who's in the legal system, then that could be something that they could do as well. I would agree with what Sarah was discussing in terms of your employers. Talk to them as soon as possible and keep in contact with them. So you want to know, what are the policies on sick leave, paid time off? Is it possible to add flexibility to your schedule? Now that we've had the pandemic, we've figured out that we can do a lot of stuff from home. Is there something that you can do to kind of change the way you work? Let's see. There's one thing that I will caution people about. It's that I'm not telling you to lie or to cheat in any way, but just to deal with the situation at hand. So if you think that you need time off, and that you might retire after that, or you might change jobs after that, don't deal with the retire or change jobs after that. Don't say that out loud. Just say that you need time off. If you do say that you are going to retire after your time off, or that you may need to change jobs after your time off, those are grounds that employers can come back and say, okay, we're going to deny your benefit. And the other thing is, get everything in writing. So if you have a conversation with your employer, when you get home, type up an email and say, okay, this is what I thought we talked about. Can you just let me know if we're both on the same page? And then keep that email and keep the response from your employer. And it doesn't have to be anything big. You don't have to print it off and put it in the binder. Maybe just stick it in a folder in your inbox. And keeping records like that will protect you from the problems that you may have. Advocating with friends and family is a very interesting dynamic. And the first key there is figuring out who's helpful and who's really not that helpful. And that may surprise you when you start going through all this. One person said, our family members don't all see this situation the same way. One person thinks we should be doing this. I think we should be doing something completely different. The friends and family also have different comfort level. So dealing with cognitive issues is very comfortable for some people, and for other people, not comfortable at all. We do know two things for sure. We know that most caregivers will accept help, but have no idea what to ask for. And we know that friends and family want to help, but they have absolutely no idea what to do. So if you can be as specific as possible in asking for certain things, that will really help out. Looking for sources of support, obviously, consider neighbors, like mowing the lawn. If you have someone who, if your neighbor mows the lawn every weekend, it's not really that big a deal to come over and mow yours, as long as your lawn's not too big. Religious or spiritual leaders, support groups work really well for some people, other people not so much. Your kids' friends' parents. So if your child, if you have a child and they're in a lot of activities, look to the parents of the other children and see if they can do some of the running around. And then you might also want to think outside the box. So talk to a social worker or a point person in your loved one's provider's office, and they've heard caregivers talk about sources of support before, so they have some ideas. The take-home messages really for advocating. Friends and family want to help, let them in whatever way you feel comfortable. Figure out who to avoid. One of the best suggestions I think I ever heard was having an information point person. So you go to your provider visit, your provider gives you a whole bunch of information, and then when you get home, you're responsible for calling 10 to 15 people to let them know what's going on. Identifying a support person support information person is really nice, because you can make one phone call and say, okay, we had the scans, this is what's happening. And then that person can call whoever you want and let them know kind of what's going on. I wouldn't do it as a phone tree. So you call one person, they call another, because information will get scattered. But having just one point person to disseminate that information can be helpful. A lot of the things that we've talked about today are applicable to both caring for an adult with cancer and caring for a child with cancer. But there's a whole other section of caring for a child with cancer that can be difficult for caregivers. And I'm just going to mention some resources here. First, talking with your child about their diagnosis. There are, and I will give this information to Emily Lippert, and she can disseminate it when she sends out the resources. St. Jude's Research Hospital, Pediatric Brain Tumor Foundation, the American Childhood Cancer Association, those can all help you. They have programs on how to talk to your children. It isn't a surprise that siblings have a whole bunch of reactions to what the family goes through. They can feel scared, left out, envious of the added attention. There's one program in particular, Alex's Lemonade Stand has a sibling program that a lot of people have found helpful. And siblings also may find helpful support groups. If you can find one that is specific to neuro-oncology. And because a lot of those siblings don't have friends that are going through this or that have gone through this. Dealing with the late effects, there is a huge impact of treatment on children. And the National Cancer Institute actually has a really large set of money set aside just to support researchers who look at the late effects of having a child having a brain tumor. A lot of times there may be late cognitive effects that manifest themselves in terms of academics. The best thing to do is to really keep in contact with your neuropsychologist, even after everything starts coming back well, just to have that kind of constant monitoring. And then lastly, planning family activities. Excuse me. Undoubtedly, if you have a child that has a brain tumor, you've figured out that you can't do the same family activities anymore. It's going to be frustrating for you guys. It can also be frustrating for other children in the house. One thing, a couple things to remember in choosing locations, you want to avoid places that have a lot of stimuli and or that require a lot of physical coordination. And one of the most important things I think to remember is that it's very important to take a break. And this is not only for kids, but also for adults. It's very important to get away from the environment in which you're dealing with a brain tumor. And maybe that's going an hour south and spending a weekend at a bed and breakfast or a hotel or, something like that. But it's okay to have fun. when you're going through this. It's okay to have positive experiences. And actually, caregivers tell us that although they do have negative experiences, there are also positive things that come out of this, which is really hard to believe right now, but it does happen. So I would like to say thank you to the families that have shared their stories with us, to you for lasting this long in the day, and to the ABTA, who actually partially funded my very first neuro-oncology caregiver study. And I think that they're a wonderful group. They continue to advocate for both you and your loved one.
Wonderful. Thank you so much, Dr. Sherwood, for sharing with us ways to empower yourself as the caregiver. We want to welcome back Sarah and Archie for the Q&A. Reminder, attendees, please submit your questions if you have not already, and we will kick off our Q&A right now.
All right, thank you so much. Let's get started and see what questions we have. So one of the first questions that we have here, and this is a really important one for caregivers and supporters, is how do you go about asking for help? Sometimes it can be hard to seem like you need that support and actually reach out to your loved ones to ask them for specific areas of support. So maybe Sarah, you can share some advice on how you might have navigated that.
I often thought about it as if it was somebody else. So like, it's hard when it's you, but you know, if somebody else needed that help, you would want them to tell you, because of course you want to be there. So I sort of flipped it and was like, okay, I need this. So I'm just going to do it, because if they were me, you know, I don't know what I'm trying to say. I'm getting a little mixed up, but there's not an easy way to ask for help. It should be easy, but for some reason it's really hard, especially when you're trying to navigate things and you kind of don't even know what you're asking for. I find being authentic is the easiest way to ask for things. And you can say, this is really hard for me to ask, and I need you to do this. I think just stating all the emotions that sometimes go into it, you don't have to be brave all the time. You can take that off and just show that you're struggling and ask for what you need, as hard as it is.
Thank you for sharing that, Sarah. I think that's really important advice. Another question we have here, we talked about the importance of having that point person that you can turn to for writing notes and things like that. But can we take it maybe a step further, Paula, and address power of attorney? Can you talk about what a power of attorney is, why that's important, and when you might designate a power of attorney?
I can. So a power of attorney is someone who is going to make medical decisions for you on your behalf. Choosing a power of attorney can be a very tricky thing, especially if people in your family don't agree. You want to be extremely sure that when you do choose a power of attorney, and actually my personal belief is that everybody should have a power of attorney, period. Not just in neuro-oncology, but really it's for everybody. Make sure that you talk through the decisions that need to be made. So if it comes to this, and you're on a ventilator, what do you want me to do? Having those communications, as difficult as they might be, make sure that you know that you're acting on your loved one's best interests. And I think that helps relieve a lot of your guilt, because you're not trying to second guess, well, what would he want me to do? You're going to, okay, we've gone through these scenarios and this is what he told me he wanted.
Thank you for sharing that, Paula. Another question we have here is about finding support. Sarah, you mentioned that you found a wonderful support group that was age appropriate, diagnosis appropriate for you and the both of you. Can you maybe share how you found that support group and what resources may be available for other caregivers looking for something similar?
Do you remember how we found it?
Yeah, so it actually came through my support group as well. And that's a natural place too, is if the patient is going to a support group, just imagine there are caregivers and concerned loved ones for all of those patients. So we had an opportunity in the early days to have a joint kind of session between Sarah, myself, and other people that were going through brain tumor diagnosis at the same time. And luckily, Sarah kind of clicked with a couple of the other spouses and that kind of a natural formation. But we were working with a particular hospital in DC that also had those avenues out there so that there could be caregiver help. But just, I think the most important part is wherever there's patient care, just glob onto that, because there's always going to be that kind of caregiver care and sessions or whatever informal or formal mechanisms that are tied to that.
And I also think it's good to, when you do find a support group, you can ask like the local hospital that you're going through. Hospice also always has like different sort of support groups that they can advise you to go to. Any sort of cancer network will have them listed on their website, but I think it's important to go to sort of like your specification. So if you can't find brain tumor young person's caregiver support group, go to like a brain tumor support group. Or if you can't even find that, go to a young person support group if you're a young person, or if you're a parent, go to a parent one. I think it's really, you can learn a lot from all of it, but if you're going because you need support, it's really helpful to find other people that are going through like the same thing you're going through, because there's very, very few of us, unfortunately. It's unfortunately, I guess I wouldn't wish this upon anybody, but I think it's best to find people that you can really like connect with.
And I'll make a shameless plug for the ABTA as well. There's such a great mentoring program that has been built out for patients and also for caregivers. So if you don't know where to turn, if you don't know who to call, or if you don't have any groups in there, call the ABTA. I think that's it's a resource for everyone that's involved in brain cancer and brain tumors, not just for patients themselves.
I would also put a plug in. This kind of addresses what some other folks were talking about earlier. Most people don't live next to a neuro-oncology center. They're rare, much rarer than, than other types of cancer. And so at Pittsburgh, we get a lot of people that will come in for the surgery, and they'll come in for a neuro-oncology consultation. But then they take that information and their local oncologist manages the treatment at home, and they just kind of go back for some follow-up visits. And so if you're having trouble finding something in your area, looking at the closest major medical center that has a neuro-oncology department is probably a good thing to do, because nowadays, especially nowadays, most places, when they do offer support groups, either offer virtual support groups or live support groups where you have the option of joining virtually. And so if you live in an area that doesn't have a lot of that support, you can kind of tag in there.
Thank you all for sharing that insight on how to find support. I do want to share that the ABTA also has a support group locator. So if you go to abta.org, you can use that tool to find support groups in your area. And we'll include all this information and the wonderful resources that you all shared in the resource document in a follow-up email. All right, so another question we have here is for you, Sarah and Archie. I think Archie, you shared that you were diagnosed back in 2011. So this has been a long experience for you. How do you deal with the dwindling of support that comes when you've been going through something as long as you have? People tend to drop off, they stop checking in. How have you coped with that or found support and additional support throughout that experience?
Yeah, it's, unlike a lot of cancers, I think people aren't necessarily educated on what a brain tumor is versus other cancers. So questions I'll get is, oh, you're 10 years out, you must be in remission, you must be healthy, everything's fine. And that's so far from the truth. I'm still doing MRIs every 6 months to make sure that we share, I think, a common word in the brain tumor community, which is stability, and stable is probably one of our favorite words now. When you go to an MRI and you're just waiting for that word stable to come across. So I think it's a change in how people care for you. And there's not as many check-ins. I think there's duality to that, in that it gives you comfort that you're kind of seen more as normal now, that it kind of takes that stigma away. But there's times when you do want people, loved ones and stuff, to have that conversation with you. The dangers of it is it's a loaded question, like, how are you doing? Anybody with, non-threatening illnesses and stuff will probably just say, doing fine, a normal day. I persuade myself to go about that same route because it helps me contain power, because I don't want to share how I'm feeling this very moment, or what my normal days look like. The outcome is I'm here, I want to be here. I try to be as positive as I can, and I try to reflect that image, so that, people that I really love, people that really love me and support me, that know exactly what I'm going through, they somehow know that how to ask that question, how to kind of intervene, how to check in. Some people surprise me by knowing, my date of surgery, my date of starting chemo, radiation, anniversary. So when I had my 10-year anniversary of being diagnosed, that was a big deal to me. And I wasn't getting the outpouring that I was 10 years ago when I was diagnosed. So it's you deal with it in different ways. But I think the critical factor of it all is you still know those same people will be there for you now, that were there for you before. And if you have that good support network, even if it's not checking in on you all the time, not making food and not doing all the things that Sarah just talked about with caregiving, it's there if you need it. I think that's the important thing, to have that hope and that belief in other people, that they can be just as supportive for you now than they were before.
I think also recognizing that it creeps up on you and then it calms down. But when it's persistent and it's staying creeping, you have to recognize that you might need some help. We had a friend pass away from a brain tumor a couple of months ago, and it shook me big time. And I sort of thought I was past a lot of these feelings, and it brought me right back. So I reached out for professional help, and that has been really helpful. I think it's good to recognize when you need it. And sometimes you don't need it all the time. And sometimes you need to reach back out. So I think it's good to know when you reach back, when it's good to know when you need to reach back out.
Thank you both so much for sharing that insight and for all the advice that you have shared with our audience today. Unfortunately, that is all the time that we have for questions. I want to thank you again. I wish we could continue this conversation, but I'm going to go ahead and turn it over to Emily.
Yes, thank you both so much, Dr. Sherwood and Sarah and Archie. We just really appreciate you just being vulnerable and sharing with our audience your experience, not just as a patient and caregiver, but as a team. So thank you so much. And thank you, Paula. Thank you for your sound advice for the caregivers out there. Well, this now concludes the sessions for the ABTA Cognitive and Emotional Wellbeing after a brain tumor diagnosis patient and family meeting. As a reminder, today's meeting has been recorded and will be sent out later next week along with some helpful resources as mentioned by some of our speakers. We hope each of you gained some new insight and helpful resources from our meeting today. Before we go, we would love to evaluate how much you gained from this meeting. If you were a part of our meeting at the start of the program, we sent out a poll where we gathered some information just to understand how much you knew about cognitive and emotional health. So we're going to compare from the start of the program by engaging with a poll one more time. All right. So the question is now, please rate your overall understanding of cognitive and emotional health. So when we first started, a lot of people selected general. And hopefully the goal is to have an increase from just the general understanding. Okay, a few more seconds. 3, 2, 1. All right, I'm going to share the results. So at the start of the program, it was almost 50% at general. It is great to see that the percentages have increased to under excellent and great. So we're all very happy to hear that each of you gained some new information from today, and hopefully each of you can further reference the recording and also the resources post-event to even learn more. We invite each of you to continue to stay connected and share your feedback with us through social media. Additionally, each of you should receive an email asking you to take a brief survey to evaluate this meeting. We ask you to please take a few minutes to share your feedback, which is truly important to us as we plan for future programs. For example, this very meeting was developed based off of survey feedback from previous meetings. We realized there was a gap in some of our educational resources about addressing the cognitive and emotional well-being and health of patients and caregivers. So we really value your feedback. So please be honest about everything that you learned from today and what we could do better to meet each of your needs. For those of you who fill out the survey, it will be anonymous, but if you enter your email at the end of the survey, which are not attached to your responses, you will be entered into a raffle for a chance to win a $25 Amazon gift card. The winner will be emailed the gift card post-event. I would now like to welcome back our chair, Dr. Logan. We just want to say on behalf of all of ABTA, we truly thank you for all your time, your effort, your leadership, for your excellent selection of topics and speakers for this program. And we're just so grateful to you and all of your leadership.
Thank you, Emily. What an incredible program. I'm so honored to have been a part of these discussions and the planning for the presentations. I want to thank the ABTA for allowing this platform to provide education and support about brain tumor quality survival. And obviously, thank you for allowing me to be part of it. And I actually want to thank the audience members as well, the brain tumor thrivers and those who love them. We see you and we are listening. We will continue to work endlessly to ensure the quality of your life is at the forefront of your care. I hope that each of you were able to take away relative cognitive and psychological coping strategies that will begin to improve your days immediately. Thank you.
Thank you so much, Dr. Logan. Additionally, I would like to thank each speaker for taking the time out today to share their insight and expertise with all of us. And likewise to all of our sponsors for their support of this meeting. Our gold sponsor, Novacure, and our silver sponsor, GT Medical Technologies, for their support of this virtual event. Without the time and effort from each of these individuals and organizations, we would not be able to bring you this quality educational programming. And just like Ashley said, most importantly, we thank you. We thank you for engaging with us. We hope you learned something new today and felt encouraged and empowered, and that you were a part of something, that you are not alone during this journey. If you're looking for more content just like this, we encourage you to stay up to date with all of our upcoming events. For example, we have a webinar coming up on ways to manage financial burden from a brain tumor diagnosis. This is such an important topic, so we encourage each of you to tune in, and this is taking place on May 26th. Additionally, we will be having another patient and family meeting coming up at the end of June, all about the advances in research and clinical trials taking place on June 25th. And last but not least, our national conference, which is our signature 2-day event, is taking place in the fall on September 9th and 10th. Each of these events just mentioned, the registration is already open. It's free for all of them, so we encourage each of you to sign up. Well, that concludes our program for today. Thank you all for joining us, and enjoy the rest of your day. We will see you back soon for some of our future events. Take care.